In fact, I welcome all of you because of these reasons, particularly wholeheartedly from the Global Alliance for Pandemic Preparedness. And I am Dr. S.R.Rao. I'm a Vice President in the Sri Balaji Vidyapeeth University in the Coromandel coast of South India. And I am also co-founder of the Global Alliance for Pandemic Preparedness and Response, along with Dr. Kai from Penn State and Dr. Sachin Chaturvedi. He could not join. He is from Research and Information System for Developing Countries, which is a think tank of Ministry of External Affairs. He has been a specialist in economics and other areas. I think with these co-founders and all the partners, we have several partners already with the Alliance. On behalf of all of them, I welcome you all for this round of interaction. Since I am sitting with my background with the APAR logo and also Alliance on Pandemic Preparedness, a little background about the history, because some of you might have already visited the website, but it is important to you at this occasion. Who are we? What are we doing? The Global Alliance for Pandemic Preparedness and Response, we call it as APAR. APAR in a Sanskrit language means limitless. I mean, everybody is included. It is a very inclusive process. APAR is based on New Delhi One Health Security Conference declaration. We had a declaration in 2019 where many ministries and 28 countries, experts from all over the world participated. That declaration called for a global momentum for taking the agenda ahead. What we are doing here is that taking that agenda in 2020, Sri Balaji Vidyapeeth University and Penn State University of Applied Biology and Biosecurity Lab, as well as Research and Innovation System. We launched this APAR in 2020. It is actually to fill the critical gap in global pandemic preparedness by facilitating truly open South-South and North-South One Health security dialogue and collaboration. In fact, a 360-degree view of COVID pandemics from the policymakers, WHO to a tertiary hospital and a college or a community health center, one would realize much needs to be done. That pain and grief actually has resulted into doing something at the global level, and that is a result of this alliance. To advance pan-regional, interdisciplinary and multi-sectoral preparedness and response capacities, skills and action, this alliance has been launched. At the same time, would like to ensure long-term regional stability and sustainability. So therefore, I welcome you all. And if you believe that the APAR mission is of global importance with all these goals, we want to invite you and your organizations to either endorse or join APAR. Already there are many partners who have endorsed, if you see the website, and join APAR's global community by visiting our website, aparweb.org, which some of you might have already visited. Jointly, we can make a true impact on advancing One Health security globally. So with these initial remarks, I would request my co-founder, Dr. Professor K from Kai, some people K, some people Kai, they say we call him as Kai, Professor Kai, to provide further background about today's evening meeting and also its objectives. Over to Dr. Kai.
Thank you, Dr. Kai. No, Dr. Kai, yes. Thank you for that, Dr. Rao. I echo your sentiments and thank this global panel for their commitment and contributions today. Over the course of the past year, we have conducted several workshops with global health security experts to identify critical programmatic priorities for APAR. One key priority that was identified is to advance the understanding of veterinary biosafety and biosecurity by hosting a global summit that addresses all intersectoral aspects of preparedness and response, translational technology innovation, bioeconomy and burden of disease, social and behavioral intervention strategies, as well as policy and regulatory issues. To ensure that such a global meeting is relevant and contextual, the objective of today's workshop is to really identify the current and emerging priorities for strengthening veterinary BS&S. Thus, I have to say, I'm actually really truly excited to be here today and look forward to the thought leadership, this truly fantastic assembly of influential global and regional interdisciplinary subject matter experts, innovation leaders, and policymakers will provide. Thank you for joining us today, and I look forward to a fantastic day. Dr. Rao, back over to you.
The sessions, I have some housekeeping or administrative remarks to make. As Dr. Kai echoed, I echo his sentiment that we want to ensure that all our global leaders who have participated here should have the opportunity to share their thoughts. So therefore, please stay within 5 minutes allotted to you, each of the panelists. And of course, you are very senior people, but I don't have to remind. But as mentioned, this session will be recorded. The recording will be used to develop a summary report that will inform summary agenda and also the actions for the future. Also, if you would provide additional comments, please provide it. You have all the emails, and also in the Zoom chat online, we will summarize all these comments and also compile them. If required, any inquiries or comments from specific speakers are there, we can also get connected with them. Finally, please make sure that your microphone is muted. Anyway, we have a system to mute whenever we want. And when you are not presenting, and I see Dr. Bhaskar Balakrishnan from representing our co-founder, RIS. Dr. Bhaskar Balakrishnan, welcome. You have any initial comments to make on behalf of the RIS? Okay, thank you. So with this, we'll start the first session. We have decided to have opening remarks from the leaders of various countries and also the global organizations. We are happy to say that we'll be starting this with the video presentation after Dr. Soumya Swaminathan, Chief Scientist of World Health Organization. Because of her busy schedule in the ongoing pandemic matters, she excused us and kind enough to send this video. Please bear with us for 5 minutes to see this video. Yeah, please. Play the video, please.
Greetings from the World Health Organization. I'm Dr. Soumya Swaminathan, the Chief Scientist, and thank you so much for inviting me to say a few words. The COVID-19 pandemic is a powerful demonstration that the health of humans, animals, and ecosystems is intimately linked. For many people, One Health may have once simply seemed a concept. It is no longer. We can only prevent future pandemics with an integrated One Health approach, which involves public health, animal health, as well as the environment that we share. One Health has to, of course, be more than a concept. It needs to be translated into systems at the local level that keep people safer. For example, we know that 70% of all emerging and re-emerging pathogens are zoonotic. And we also know that there is the possibility of the next pandemic, or disease X, as the WHO called it. We don't know when that pandemic will happen or where it will happen, but it is certain that it will happen again. But One Health needs to be more than just zoonosis. We cannot protect human health without considering the impact of human activities that disrupt ecosystems, encroach on habitats, and further drive climate change. And these activities include pollution. We have to think about both indoor and outdoor air pollution, large-scale deforestation and extraction, the intensification of agriculture and livestock production, the farming of both domestic and wild animals, the overuse and misuse of antibiotics, and the way that we produce and consume and trade food. The WHO definitely supports a One Health emphasis, which is also linked with the environment. And this has been actually outlined in the manifesto, the WHO manifesto for a healthy and green recovery from COVID-19. Indeed, it's quite ironical that it takes a pandemic and COVID-19 for us to drive change, to do things differently going forward. The whole world is interested in One Health now. It's going to be discussed at the forthcoming G7 and G20 meetings. Many national consultations are happening on this. There is a tripartite, which is the FAO, the Organization of Animal Health, and WHO, which along with the United Nations Environment Program, so it's a tripartite plus one, are really taking up very seriously the issue of tackling the whole area of One Health and formulating frameworks and policies to be able to also monitor it at the global level. We've seen a lot of collaborative activities both at the global level but also at the regional and the country levels. For example, there is a launch of the United Against Rabies Forum, which is an example of all the different agencies and stakeholders coming together to tackle the problem of rabies, which unfortunately still kills a lot of people in the world. We continue to make progress in establishing the governance structures that will curb the threat of antimicrobial resistance. For example, we have set up a global leaders group that held its first meeting this year. It's going to have regular meetings, and there will also be an establishment of an independent panel on evidence for action to tackle antimicrobial resistance. WHO is planning to scale up further investments in One Health and work along with the partner agencies to build consensus, to make sure that there's collaboration and have some action items which are priorities. And we need to ensure that all the partner organizations really come together and that governments also invest in this area of work. So we are at a very critical juncture now when we have recognized not only the importance of zoonotic diseases that can turn into pandemics, but also, of course, the present threat of climate change. And the one way to address all of these issues together is really to bring public health, disease prevention, and environmental protection and sustainable livelihoods, particularly in the agriculture and veterinary sector, all of these together. So if the pandemic has taught us anything, it's that we're all stronger together. We need the science. We need the science to drive and produce the solutions, but we also need the solidarity. And this is where another area which affects the world as a whole, and therefore we need global solidarity and collaboration to tackle this. Thank you very much.
The science and solidarity. I will now switch on to go to India, a national perspective on opportunities and challenges for veterinary biosafety and biosecurity by Dr. B.N. Tripathy, who is a top scientific official and a technocrat at the Deputy Director General in the Indian Council of Agriculture Research. So we're happy that you are online and the time is yours. Yes. Over to you, sir.
Thank you, Dr. Rao. Am I audible, everybody?
Yes.
Audible? Okay, thank you. So, Dr. Rao, the co-founder of this alliance, APAR Alliance for Pandemic Preparedness and Response, Dr. K, and I can see Dr. Rahman, and there are so many esteemed colleagues from many other parts of the world. So thank you very much, Dr. Rao, for giving me this opportunity to share my views on this occasion. And in fact, Dr. Swaminathan has very clearly set the agenda for the entire meeting by giving a very solid message from the WHO that how COVID pandemic has really opened our eyes and has really cautioned us that this unseen virus, what it can do in the country. Now, coming to the concept of this biosecurity and biosecurity, it is not a new phenomenon. It has been existing since 1950s, and of course it has gained more importance after 1990s when we struck up with some avian influenza problem and SARS, MERS, Nipah, CCHF, and so many viruses, and especially it has become a buzzword, at least for SARS coronavirus 2, that has really hampered the entire world. Now more than 200 countries have been affected with that. So coming to the importance of veterinary biosafety and biosecurity in Indian context, and this is very important because we have a very huge population of livestock, more than 536 million and 852 million poultry, and having a spectrum of disease here. And also these animals, these livestock and husbandry as such contributing significantly to agricultural GDP with more than 33%, and also to national GDP to 4%, more than 5%. And also we know that, as has been stated, that 60% of all human diseases are of animal origin. And during last 30 years, every year new diseases has occurred in the human, and almost 75% of all the diseases are of animal origin. So the concept of One Health has to be instituted very clearly. Now people realize that how veterinary, agriculture, and animal science, and veterinary science, and environment, all are joined together, and can really come up with a solution to solve these problems. In India, if I talk of veterinary laboratory that we have in the country, we long back we realized the need of BSL-3-4 laboratory in 1980s, and our dream comes true. And in 2000, we were able to construct a very good BSL-4 laboratory at Bhopal. And after that, we have got a few more laboratories in the ICR system, and currently in ICMR also we have got BSL-4 laboratory at Pune, and at least dozen of laboratory BSL-3 has been created by ICR, by DBT, and by other organizations. But they're not sufficient for a country like India. So we need to have some more BSL-3 laboratories. And also, we should have BSL-4 laboratory to handle risk group 4 pathogens in the country. So, and also government of India is trying to create those. And on the side of that, when COVID occurs, we had only few laboratories on tips that can able to impart diagnosis for COVID-19. But within a span of 3-4 months, we were able to enhance our laboratory capacity to more than 2,000. So, but this has to at least biosafety level 2 facility should be available in each and every veterinary and medical institution to really to cater to the need of our emerging challengeable diseases. Now, however, we have to see that how these in like developed countries or developing countries, it is always a bit difficult for developing countries to sustain such like laboratory, because recurring cost of BSL-3, BSL-4 is very high. Now, the second point that I would like to emphasize upon the biosafety equipment. So, they're also very expensive, and if indeed us in the COVID period also, we have been able to produce our own lot of equipments and indigenized equipment, and therefore it was very cheap, and it could able to purchase and under the cost of our people. And third thing I would like to emphasize is the biosafety training and awareness. This is very important. We have been imparting training to our FISDA laboratory, and it is all funded by WHO, FO, and many government organizations. And the fourth point that I would like to see that in curriculum of graduate and postgraduate students, we should start biosafety and biosafety program for them also. And if a certification course could be there, that would be very good. And then we had in India, we have got the various authorities which are dealing with the biosafety and biosecurity. DBT is one, and husbandry ministry and the environmental ministry. So we can have a unified authority that can deal with these biosafety and biosecurity issues. And then third thing that we are having a porous border. Lot of challenges, lot of diseases are coming out from our neighboring country. So can we have a regional cooperation mechanism where we can really go for our rapid communication of our messages and so that we can able to tackle the diseases. So with this, I thank you very much. That there are many things to talk, but I think time is over. So with this, thank you, Dr. Rao, for giving this opportunity. We'll discuss
Thanks,
it.
Dr. Tripathi. I'm sorry for that
Okay.
because we have to go. I now switch on to Dr. Bangladesh on a similar topic of national perspectives. I request Dr. Muhammad Rafiq Islam, Chief Scientific Officer, Bangladesh Agriculture Research Council, Bangladesh. Dr. Muhammad, your time is on. Dr. Muhammad Rafiq.
Yes, sir. Thank you very much, sir. Uh, I like to first give to thanks to the co-organizer for inviting me to give some speech on this valuable conference on global veterinary biological safety and security. This is Dr. Rafiqul Islam from Bangladesh Agriculture Research Council. So, as we know, the laboratory biosafety and security is a very important issues now globally, because laboratory biosafety and biosecurity system are used around the world to help to mitigate the risks posed by the dangerous pathogens in the laboratory. Veterinary laboratories carry unique responsibilities to workers and communities to safety and security handle disease causing microorganisms. In recent days, we are facing many zoonotic diseases all over the world, including the Bangladesh. Now we're facing the corona pandemics. Now, global concerns are over emerging and transboundary disease, zoonotic diseases have increased disease diagnostic demands, especially in the veterinary sector. In developing and newly developed countries where the sector often works under limited capacity, biosafety and biosecurity are unlikely to be high priority issues. The increased national demand for improved disease detection and control has resulted in the expansion of diagnostic and research capacity. The increase in the infectious disease detection capacity has not necessarily been paralleled by an increase in biosafety and biosecurity capacity, particularly in the low resources countries. Low resource countries face numerous challenges that severely constrain the development or expansion of sustainable capacity in biosafety and biosecurity management. Now, in this context, in the pandemic situation in the Bangladesh, the many veterinary laboratories are supporting for diagnosis of these corona pandemics in Bangladesh. More than 100 laboratories are working with the corona pandemics facing this situation. In Bangladesh, we have some good laboratory, especially for the avian influenza. This is the reference laboratory for Bangladesh. In this laboratory, we have also giving facility for corona pandemic diagnosis system. So these recently the other outbreaks like the SARS, MERS, Ebola, Nipah, dengue, or chikungunya, Zika virus have exposed in this country all over the global also. These viruses are genetic and spreads from the animal to human, and some of them are escaping from the laboratory for improper handling of the animals. See, in case of Bangladesh, has vulnerable to such infectious diseases due to because of this geographical position, large dense population, low healthcare expenditure, weak coordination, poor awareness of biosecurity, shortage of healthcare workers, lack of trained personnel, insufficient disease reporting and surveillance, improper practices handling of animals at farm, slaughterhouse, and shop. So we have many threats and risks nationally for naturally occurring infections due to the climatic condition, vector-borne disease, high density of livestock population, poorly guarded animal-human interface, like the avian influenza, swine flu, Nipah, coronaviruses. Then we have some facing problem for poor patient adherence to the antibiotic treatment, non-therapeutic use of the antibiotics, illegal and over the country access to antibiotics and self-medication. So in this context, we set some priorities. Major veterinary biological safety and security have some challenges, like the harmonization and enforcement of established biosafety and biosecurity policies nationwide, and consistent support from the management levels. Budget constraints resulting in insufficient maintenance of safety equipment and compromised safety features, insufficient staff awareness and engagement on biosafety and biosecurity measures. Good laboratory practices are not strictly enforced, as these are not considered as one of the top priorities. Besides this, we have opportunities to further improve the veterinary biological safety and security capacity. We may establish the safety committee with assigned biosafety officers, educate and functional biosafety and biosafety infrastructure, equipment, and workforce, existing standardization activities that provide foundation skills of documentation, strategic planning, and enforced operations.
Okay.
Yeah, but I should mention one thing, that is the biosafety plan and management should be revised annually, especially for Bangladesh. Drills and exercise should be practiced regularly to raise staff awareness in biosafety implementation and to identify the weakness for improvement. The biosafety manual should be specific to each laboratory department and tasks. Like in case of pandemic, we should make the biosafety manual for each laboratory. So
Dr.
finally, I'd like to give thanks to the organizer for inviting me. And hope I best wishes to the workshop for a grand success. Thank you very much.
Thank you, Dr. Muhammad Rafiq. Actually, that was very good perspective from the Bangladesh point of view. In fact, we have a very important guest from International Livestock Research Institute, Deputy Director General R&D, Dr. Director. Sir, thank you for giving us opportunity. Can we put the their PPTs on? Dr. Director?
Hey, yeah, have you my slides?
Yes. Slide.
Okay.
PPTs. Yes, sir, it is on.
Okay. Thank you very much. I hope you can hear and see me. Thank you very much for inviting Ilri, me personally, and my colleagues, which will speak later, to this virtual planning workshop for Global One Health. And we are very happy there, and I'm very happy to tell you about the International Livestock Research Institute. Next slide, please. So you see we are hosted in Ethiopia and Kenya, but we have 8 other offices in countries in Africa, and we have 4 offices in countries in Asia, which is mainly China, India, Nepal, and Vietnam. We have more than 600 staff members, and we have a budget of about $100 million. If you see that there are distribution in the world, but we work in over 20 or 30 countries with other partners currently. The one slide, the one photo shows you the laboratories we have in Nairobi, where we have labs, we have farm facilities, and we have an environmental research center, which is very unique in Africa, because we have respiratory chambers where we can measure the greenhouse gas emission depending on genetics and feeding and so on, which is very, very special for Africa and very helpful. Next slide, please. So biosafety, we have a biosafety BSL-3 lab where we do our coronavirus research and where we do our AMR research. And we have a BSL-2 plus stable facilities where we can have more than 100 pigs and 30, 40 cattle. And you see all the requirements you have to have for biosafety levels. But I think it's important also to mention on a global view, the Cartagena Protocol on Biosafety, which is to the Convention on Biological Diversity, and is an international agreement. The Biosafety Protocol seeks to protect biological diversity from the potential risk caused by GMOs resulting from modern biotechnology. And we have in our labs, we do a lot with genome editing and genome sequencing. So this is something where we have to follow closely and to make sure that the developed nations can balance the public health and the economic benefits of this type of research. The next slide. Biosecurity is very difficult to manage in the developing countries. And you know, for me, it's always important that we have a comprehensive biosecurity program, and this should represent a hierarchy of conceptual, structural, and procedural components. They're all directed at preventing infectious disease transmission within and across farms, regions, countries, and continents. And you can see the conceptual biosecurity component is that the animal facility should be in a location where it's limited, where you can limit the physical, limited the risk by physical isolation. There's structural biosecurity, which can be the layout on farms and the perimeter of fencing, drainage, and so on. And the procedural biosecurity, this deals with routine procedures to prevent introduction, so the bio-exclusion, and biocontainment, which is the spread of infection within a facility. And I think that's the major challenge, to make sure that we get all these biosecurity components translated into the situation of small-scale farmers and small-scale livestock handlers. Next slide, please. Just only to mention that there is also the OIE reduction strategy on biological threat. We know that animal pathogens may be used as bioweapons or in bioterror, and all these and pathogens are listed at the OIE, and it's an informative thing. My last slide is on telling you about our ILRI One Health initiatives. ILRI is working since decades on One Health, and we developed a new One Health strategy now, which is based on the Manhattan Principles, and is a holistic approach to preventing pandemics, epidemics, and other microbial threats from animals and the environment. And our vision is to improve the lives, livelihoods, and well-being of people in the global south by building healthy, sustainable, and resilient system at the intersection of humans, animals, and the environment. And the focus is on endemics and pandemics caused by emerging and re-emerging viruses, endemic zoonosis, foodborne zoonosis, and antimicrobial resistance. And this is the One Health triad. And an example, last year we have founded a One Health Center for research, education, and capacity building in Africa, which is working with all the African partners and is trying to fill the gaps which are there in this type of research, which is necessary. So this is an important initiative we are now also intensifying over the next years. And we do this not only in Africa, so in Asian countries as well. Thank you very much, and thank you for inviting, and you will hear more from my colleagues later on.
Thank you, Professor Dieter. Actually, it was very interesting to show the priorities of ILRI, which are priorities of many developing countries. Thank you very much. As we are already in Africa now, we will call our great friend and also partner of our alliance from the African Union Development Agency, and he is the head of Science and Technology Innovation Hub. I invite Dr. Agri Ambali. Please share his views on Africa, opportunities and challenges in this topic. Professor Ambali.
Thank you, Dr. Rao. Thank you, Dr. Rao, and indeed organizers for inviting me to make some remarks at this, conference. My name was introduced. I'm Agri Ambali from the African Union Development Agency based in South Africa. Indeed, from the African Union perspective, speaking to this workshop, I would like to focus on One Health pandemics and the African Union, opportunities and challenges. As a gentleman, as we know that we are in the middle of the pandemic, where lives have been lost, and there have been several cases of the of COVID-19, I think in excess of 113 million. And indeed, many experts believe that the new strain of this coronavirus likely originated, in bats or pangolins. That speaks to, I think, to the subject that we're talking about here, whereby we find ourselves, in the middle of a pandemic that basically, that has really, ravaged, the globe from all angles, and the pandemic itself being driven by zoonotic diseases. So this basically highlights the importance of One Health approach to global health and safety. At the African Union Development Agency, we believe in priorities, which basically are key in working towards, the One Health arena. And these basically the three priorities are policies, innovation, and capacity strengthening. We believe these are key, to trying to address the whole issue of One Health. Now, in terms of policies, I'm speaking to experts here in this field, and I'm sure you are aware of the fact that zoonotic diseases are not new, and there have been several national policies in most of the countries, that speak to basically how to basically manage the risks and impacts of zoonotic diseases. The question though is how relevant are these policies now in light of all these advances in research, as well as pandemics like the COVID-19. So we need to work to ask ourselves from that front, are the policies still relevant? Now, how do we regulate livestock and wildlife markets, for instance, to reduce risk of disease and disease spillovers? How do we monitor our farms? How do we monitor our safaris? And as well as the human livestock wildlife interface to reduce disease transmissions? How do we, in the socioeconomic context, avoid making livestock and wildlife reservoirs or spillovers host the diseases basically that are being that we are seeing now? So this basically they need policies that basically need to basically to be speaking to some of these emerging questions as we encounter more and more challenges. So although policies and regulation may not be balanced here, they have a role to play in the they have a role in the to play in veterinary biosafety and biosecurity. Innovation, very important. We cannot just have policies on their own. We need more than just developing policies, but we need innovation in the veterinary biosafety field. Innovation that basically will be there to support disease control and mitigation. For instance, in the wildlife farming, there are inherent challenges in monitoring and control of diseases that target that basically that innovations can address. We need rapid and cost-effective testing kits, and I think the speaker that came after me, the Deputy Director General from IRI, was speaking some of these. Advanced epidemiological tools. Some of that I think we need to be producing from innovations. I'm happy that the AUDA, the African Union Development Agency, we have partnered with IRI before, and have invested in facilities that we are being shown by the Deputy Director General here. So really, I think countries, regional entities, supporting innovation is something that is also key if we are to attain the ambitions that we're trying to put on the table in terms of livestock biosafety and biosecurity. And again, with this is, we need a network-based One Health initiative. And that's why actually this workshop is very important. That's pulling, us from different angles, of the globe. And then the other issue, the issue of capacity building and strengthening. The African Union Development Agency has partnered with several entities or several institutions to really support the capacity building in livestock, in the area of, veterinary, biosafety and biosecurity. We have supported member states in actually putting together national as well as regional biosafety frameworks. This is across all the African Union member states. In capacity building, we have partnered, with institutions that, again, I will mention here being one of them, that we've partnered with to invest into, facilities that actually are doing a great job on the continent in training, African men and women in the whole area of biosciences. So really, I think as the pandemic has highlighted, one outbreak can have global consequences. Therefore, we need to ensure cross-border, collaboration and capable institutions and human resources to prevent and control diseases. Ladies and gentlemen, I'm convinced that the platforms such as Global One Health Veterinary Biosafety and Biosecurity Summit has the potential to address these priority areas that are cited above. And also, there's an opportunity in the pandemic, or the budget in the pandemic has been for global relevant discussions to be held in terms of preparedness for any future outbreaks, and we need to evaluate on it adequately. Africa is a very good example. We managed, the first wave of the pandemic, building on the experience that the continent has developed from, some of the, epidemics that have been there, in the past. This cannot be a missed opportunity. Thank you.
Thank you, Dr. Ambali. I think that gives an overall perspective of the African Union and the work that is being carried out. I think we are going to an interesting topic with all these, priorities identified from various global leaders. I now go to funding perspectives and priorities by Dr. Srivalli Krishnan. She was one of the participants in the One Health Summit, which happened 2 years ago. She is a Senior Program Officer for Agriculture Development, Asia, Bill and Melinda Gates Foundation. Srivalli, please.
Thank you so much, Dr. Rao, and it's a pleasure to be part of this illustrious panel today. As it has been stressed by several speakers today, that it has been recognized that the health of people is closely connected with the health of animals and the environment, and the One Health concept requires a multi-sectoral, transdisciplinary collaboration and coordination at local, regional, national, global level, and together with a shared vision of achieving much better health outcomes for people, animals, plants, and environment. It is the World Bank had suggested that even a low-level pandemic could globally reduce the production by almost 1% of the GDP, a moderate by 2%. But what we are seeing as the impact of COVID-19, the impact in trillions of dollars that it would cost the economy of a zoonotic disease estimated to really take years of progress and setting us back. This is a real testament to what One Health platform needs to do together. The One Health approach is particularly important for countries in South Asia, including India, Bangladesh, Nepal, where almost 6 out of every 10 new emerging infections in humans are spread through animals. And a large fraction of the population is living in rural areas dependent on agriculture and in close contact with livestock and other animal species. Endemic zoonotic diseases like anthrax, brucellosis, tuberculosis, rabies, together with several zoonotic infections, are well documented, and also they are showing emergence of antimicrobial resistance that is of particular concern to these nations. Taking in line, and in fact, way before the pandemic, in 2019, when the co-chair of our foundation, Bill Gates, had visited India, he had raised this issue with the Prime Minister of India to have an One Health initiative that is supported jointly by the Government of India to prevent, detect, and control infectious diseases capable of spreading through animal-human interface via a well-coordinated mechanism. In this context, in 2020, together with the Ministry of Fisheries, Animal Husbandry and Dairying at the Government of India, we have set up what we call as a One Health support unit that will contribute to the strategic goal of increasing agriculture productivity and smallholder farmer incomes by providing a platform of establishing new livestock products, technologies to improve animal health against priority diseases. Through the establishment of the One Health Support Unit, which we are implementing through the program partners EcoHealth Alliance, this unit is going to be based at the Ministry of Fisheries, Animal Husbandry and Dairying, and will include representatives from health and environmental sectors that will provide the technical support to the department, and as well as work with the department to pilot what we call as state One Health platforms in locations that will be determined through stakeholder engagements and also aligned with the World Bank Health Preparedness project. As one of the first things that we want to do together with the Government of India is a One Health gap assessment, and of both at the federal level but also at the state health systems, which will include a process of selecting where we will be piloting the One Health platforms. We want to establish these platforms in one or possibly two states within India, but also in a process of the development of a One Health surveillance and response systems together with the Health Ministry, Ministry of Livestock, but also together with other players such as Department of Biotechnology, and as well as under the aegis of a new One Health task force that has been set up under the Office of the Principal Scientific Advisor. We are very keen that this coordinates from the human, wildlife, domestic animal disease surveillance, and also sets up a regional policy of practice. One of the important pieces of this work that we are planning to do is to identify training needs as well as mechanisms by which we build on human capital in the epidemiology and One Health space in the country and in the region. The idea is that we test out this methodology and create a roadmap for expansion of the state platforms through regional centers and adding more institutional partners and strengthening at the federal as well as regional transboundary coordination of One Health policy and practice by the next 3 to 5 years time frame. Given the importance of this work, but also the work that APAR is doing in terms of really bringing in global leaders, we would be welcoming in terms of partnering with APAR in this entire initiative together with the Government of India as well as the World Bank in terms of achieving some of these objectives. We are keen that this particular program will be a knowledge as well as a program management partner for the Ministry of Animal Husbandry and Dairying, but will also support in terms of design and implementation of newer programs that come under the international financial institutions, both at the interministerial, interdepartment, and interstate level. We plan to use this One Health Support Unit as a platform for also utilizing national as well as international subject matter experts for consultation. And again, in this regard, we'll be very keen to partner with the large sectoral expertise that we are seeing in this room, but also in terms of how this will help in terms of accelerating the priorities towards One Health, both in country, but also in terms of the regional level. As I said, this is something that we started off in mid of last year. Without knowing that we would be in this pandemic for such a long time. But as I said, we have set the ball rolling. We already have the One Health Support Units core staff team in place and working closely with the India's Chief Veterinarian and the Secretary for the Ministry of Livestock in terms of how we coordinate this effort together with other partners such as ICMR, also the Department of Biotechnology, the Wildlife Authority, and other stakeholders who are important. I think having a very siloed approach will not work. it is important that we look at coordination. And I think not only coordination at the national level, but also at the regional level is also very critical for us to take these impact of this program forward. With this, as I say, thank you for this opportunity, and again, look forward to really putting that One Health in the agenda of a global network, but also in terms of global partnerships as well. Thank you.
Dr. Shivali, I think that gives a clear picture about how BMGF can associate with the APAR, and we do our national, regional, and global. That is exactly the perspective. And further, we believe in not policy, as Dr. Ambali said. He is a great partner to our alliance already, that we would like to do action through networks and alliances at global level for various programs and schemes. Will come back to you when those things happen in the future. I think with this, I'll close my session to be moderated. I will pass on to my co-founder and my friend from Penn State, Dr. Kai, to do the proceedings of global organizations and networks in the session 1 after the opening remarks. Professor Kai, over to you.
Thank you so much. It was really a fantastic opening, and opening in terms of eye-opening as well, and emphasizing all the different aspects of One Health security and the challenges that are present globally in the different areas. I would like to make some remarks, administrative remarks first. I really ask everybody who's presenting to stay within their 5 minutes. I will give you 1 minute warning. I will raise my finger so that you know what your time constraints are, because otherwise we will not be able to get through the workshop in time and have the opportunity to hear from everybody. Our workshop session 1 is going to focus on global health security organization and networks. And I would like to open the floor for Dr. Pasang Chering, who is of the World Organization for Animal Health and the regional representative for Asia and the Pacific. Sir, please, you have the floor. Dr. Chering, are you there? We cannot hear you, sir. You seem to have a microphone problem. Are you there now?
Voice.
We cannot hear your voice. So, Dr. Chering, what we're going to do is give you an opportunity to figure out the problem with your microphone. I will actually move to Dr. Andre, who is the Senior Infectious Disease Technical Advisor for the Bureau of Global Health, Office of Infectious Disease Emerging Threats Division, USAID. And I will come back to you after that, Dr. Chering. Dr. Andre, would you please take the floor?
Yes, thank you, Kay. And thank you for this opportunity to speak to this group this morning. Can you hear me okay? Can you hear me?
Perfect.
Yes.
Okay, great. So I just have a short presentation that I wanted to share with everyone to give a quick overview of USAID's work in this particular area, and also that also illustrates our fidelity to the One Health approach for quite some time. So let me go ahead and I'm going to share my screen, and I hope this works out just fine. Please let me know if you can see my screen.
Perfect, we got it, yes.
Okay, all right, okay. And again, thank you for this opportunity to speak this morning. I wanted to highlight the USAID FAO partnership that we've had with global health security, and specifically some of the activities and approaches that we're taking to improve biosecurity in livestock value chains. Just to give a little bit of background about the work that we do at USAID, we've been involved in the One Health approach and dealing with zoonotic threats for quite some time. This all started back in 2005 when the world was made aware of H5N1, the highly pathogenic avian influenza, and all the issues that come about from the spillover of diseases, whether that be wildlife or domestic animals to the human population, and has public health implications. Over time, our project has evolved and expanded. We started off with highly pathogenic avian influenza. Then we saw the need to expand into more broadly into emerging pandemic threats and understand that interface between animal populations and human health. We then evolved into the Global Health Security Program and Global Health Security Agenda. Again, really looking to go beyond the emergency response and the understanding of the issues that result in spillover events, to really partnering with countries to help strengthen capacity for countries to be able to prevent, detect, and respond to these emerging threats. And today we're continuing to expand our approaches in global health security to include a deeper dive into understanding the roots of the disease transmission, characterization of viruses, and so on and so forth. And again, we're continuing to work in a One Health approach and One Health platform, a multi-sectorial approach, and working with various developing countries in both Africa and Asia to continue to prepare and to get ourselves aligned with being more able to deal with, not only as COVID has shown us global pandemics and pandemic threats, but are hopefully won't be future with continued threats. As I mentioned, the main thrust of our global health security program is to prevent, detect, and respond to emerging threats. And also with the global health security program, we're really partnering with countries to strengthen capacities to do just those three things. We have the thing that I wanted to outline today is specifically the work that we're doing in prevention with FAO, although our FAO investment, as well as other investments with other partners in global health security, also address the response and detection aspects of our approach. But the subject matter that we're talking about today in terms of biosecurity is more specific to our prevention aim in our work with FAO. Just to give you an idea of the countries that we partner with, which is also very pertinent to this audience, would be the work that we do in Asia, and specifically South Asia. We have partnerships with FAO and other partners in Bangladesh, India, and Nepal, but we also work in Africa, as well as other Asian countries. The more specifics on the USAID FAO partnership in biosecurity and biosafety, we have really began to understand the importance of community engagement, the public sector ownership, and also private sector buy-in in terms of moving and building more biosecure and biosafe farms and reducing risk along value chains. And so that has resulted in activities that we have that are focused on capacity building. We've done some work in particularly in Bangladesh for model farms, and that's allowed us to really focus on improving biosecurity throughout the value chain. Also looking to go into public sector policy to deal with registration, auditing, and certification to have this more sustainable and more so integrated as an institutional approach to improving biosecurity across value chains. Here, my last slide, I just have a couple examples of some of our priorities and some of our work. I'll just leave that slide up and stop at that point. So I know I want to make that 5-minute deadline. I hope this was insightful and some of the work that we do with FAO and the approaches that USAID takes. Over.
Dr. Andre, fantastic. Thank you so much. This was excellent and great insight. I appreciate it. Dr. Sharing, shall we try again? Is your microphone working?
Can you hear me now?
Outstanding. Please go ahead, sir.
Oh, thank you very much. Good morning, good afternoon, and good evening. First of all, I would like to thank the organizers, Dr. Kaya and Dr. Rao, for the opportunity offered to OIE to share the OIE's perspective on the occasion. Let me first briefly talk about OIE's structure and governance for those who may not be familiar. Now, Office International des Epizooties, or OIE, is an intergovernmental standard setting organization with a mandate to improve animal health and welfare worldwide. Set up in 1924, it is now known as the World Organization for Animal Health, though we still maintain the historical acronym of OIE. Now, it has 182 members or member countries or territories, and is recognized as a reference organization for the World Trade Organization, WTO. The organization functions under the authority and control of the World Assembly of Delegates, comprising of the 182 national delegates designated by the governments of respective members. It has its headquarters in Paris and has 5 regional and 8 sub-regional offices currently. Now, OIE's core missions are first, setting up international standards for improving animal health, animal welfare, and veterinary public health worldwide through the Terrestrial Animal Health Code and Aquatic Animal Health Code, and also the Terrestrial Manual and Aquatic Manual, which are for vaccines and laboratory diagnostic production standards, and which are regularly updated. And the second one is the transparency, that is sharing in real time the reliable information on animal disease situation worldwide for global health and safety. So OIE maintains a global database on animal diseases, including wildlife diseases, called the World Animal Health Information System, or WAHIS. Now, the third one is the solidarity, through developing international solidarity to achieve better control of animal disease in the world. This is achieved mainly through conduct of performance of veterinary services pathway exercises. And the fourth one is expertise through collecting and analyzing and disseminating veterinary scientific information worldwide. Now let me touch on the regional perspective and priorities. A multi-sectoral One Health approach, as our earlier speakers also emphasized, is key to many of the organization's activities, as animal health is interlinked with human and environmental health, such as zoonotic diseases and AMR. So OI believes that controlling all animal pathogens at the animal source is the most effective and economic way of protecting animal health, human health, food safety, and food security. Therefore, it promotes collaborative and multi-sectoral approach centered on the concept of One Health. Now, let me share a few initiatives and tools that the regional office in Tokyo undertakes or promotes, especially around the One Health approach. One is the regional One Health tripartite coordination group. Now, after the formal alliance between the 3 organizations of FAO, OIE, and WHO, the group issued the tripartite concept note in 2010 and signed the Memorandum of Understanding in May 2018, agreeing to set up joint action to combat health threats associated with interactions between the human, animal, and the environment. Now, following this, the Asia-Pacific regional offices of the 3 organizations, that is the original OIE regional representation for Asia and the Pacific, which I represent, OIE regional of FAO regional office for Asia and the Pacific, WHO regional offices for Southeast Asia and Western Pacific, initiated the establishment of a regional coordination platform. A regional tripartite coordination group was then established in 2020 through signing of a statement of intent to coordinate by the heads of the regional offices in October 2020. The regional tripartite coordination group holds meetings every 1 to 3 months, sharing updates on activities conducted and upcoming activities by respective organizations, and also discussing on collaborative activities we can conduct together. The group secretariat rotates among the 3 organizations and on annual basis. So currently OI is heading the secretariat. And next week we have the tripartite meeting. Even before the Secretariat was established, some collaborative activities such as the biennial regional workshop on multi-sectoral collaboration at the animal-human ecosystem interface has been going on since 2010, led by one of the regional offices on rotation basis. The 9th in series is going to be held this year and led by OIE. Now, under this regional tripartite coordination mechanisms, we conduct joint activities such as the rabies workshops for Southeast Asia and South Asia in 2018 and 2019, respectively, towards the goal for elimination of dog-mediated human rabies by 2020. Besides, we support each other in organizing various activities on rabies, AMR, avian influenza, food safety, wildlife health, etc. Now, the second one is the PVS and the associated target support. That is the performance of veterinary services and associated targeted support. Now, PVS Pathway is a flagship program of the OIE, as I mentioned earlier, delivered through the use of capacity building tools and activities. The regional office supports implementation of various pathway missions and associated target support activities to build capacities and capabilities of the veterinary services in the members, and building resilience against future health crises. Such activities. Sorry, just 2 minutes.
1 minute.
Okay. Such activities are to ensure that members conform to and comply with OI's quality standards and guidelines. Now, the other one is the promoting multi-sector coordination mechanisms and activities in the members. This is mainly achieved through conducting international health regulation, IHR, and PVS pathway national bridging workshops. National workshop is joint OIE WHO activity based on the WHO OIE operational framework for good governance at the human-animal interface through bridging of WHO's IHR and OIE's PBS tool for the assessment of national capacities. The workshop identifies gaps and strengthens the international collaboration at national level through developing roadmaps in implementing joint intersectoral collaborative activity. Now, one is the wildlife health initiatives. One area which has gained much focus since the COVID-19 pandemic in 2019 is the wildlife health. OIE has developed a wildlife health management framework, which will anticipate, reduce, and manage the risks of spillover events of pathogens between wildlife, livestock, and human. So regular dialogues have been initiated with World Wildlife Fund, WWF, regional offices, and since 2020, and we are having some regular meetings to identify common grounds and collaborate and partner at the regional and national levels. So we are also conducting a number of regional, sub-regional workshops in the region on wildlife health over the last few months. So apart from that, we organize a lot of workshops on different topics of rabies, AMR, food safety, wildlife health. Let me stop here for the interest of time. Thank you very much for listening.
Dr. Pasang, it was great to hear about all of your different programs that are going on, and I'm actually very keen for us to learn more about your activities, and we will definitely engage with you later. Thank you for staying up at this late hour in Tokyo, and thanks for joining us. Have a good night and good rest. We will reach out to you. Thank you. I'm now reaching out to Dr. Habibur Rahman, ILRI, a regional representative for Southeast Asia, or for South Asia, I'm sorry, and he's going to be talking about the importance of global network alliances. Please go ahead, Dr. Rahman.
Thank you, Dr. K. I'm audible?
Yes,
I'm audible.
Go ahead, sir. Go ahead, sir.
Yeah. Good morning, good afternoon, good evening, where you are there. First of all, I thank Dr. S.R.Rao, my close friend, and Dr. K also for involving me in for organizing this event, and also inviting me on to speak on some issues. Dr. Dieter Didier ILRI has already mentioned about biosecurity, biosafety, and the role of ILRI, in particularly in the developing countries. And now I'll speak particularly on the South Asia as well as India, because I want to give an example why the global network is very, very essential. Indian subcontinent, as you know, the South Asia as a whole identified as the hotspots for vector-borne diseases, AMR, and zoonotic diseases. Many speaker has already been mentioned about the zoonotic diseases, but I want to mention about here the pathogens that we are many countries or many organizations using as the bioterrorism are also more than 85% are from animal origin. Above that, India having international border with 6 countries like Pakistan, Bangladesh, Bhutan, Nepal, Tibet, Bhutan, China, and Myanmar, and also separated by water bodies by 2 countries like Sri Lanka and Maldives. And the border of these countries are very porous, and there is an unabated movement of animals as well as human beings that brings many diseases to the country and as well as the other. Because of this geographical vulnerability, many diseases enters in India like bird flu, CCHF, Ebola, PRS, particularly disease of pigs, and recently that during the COVID infection, ASF also entered the northeastern region of the country, particularly Arunachal Pradesh and Assam. And another thing I just want to mention, because most of the emerging diseases, they are not only zoonotic, they are also the transboundary in nature. And another thing that they're essential, should be taken as when we are talking about the controlling, it should be on the on-health approach. Because of the international travel, fast communication, now world has become a global village. And when we are talking about the controlling of the animal disease, because animal disease and our animal health is directly to the human health, it will require the network, the global network, the regional network, and particularly the country within the country network is very, very essential. That's why I'm very thankful to the APAR and this organization for bringing all those people together and discussing about the network that could support the control and prevention of the diseases. Just I want to mention here, because time is very short, with missing link. I'm also very thankful to the APAR bringing the countries like all the countries from South Asia. And as you know that in South Asia, most of the countries, we have apex bodies, particularly dealing with the agriculture and animal husbandry, like Indian Council of Agricultural Research. NARC has also joined today. NARC means National Nepal Agriculture Research Council. BARC has already spoken, but I could see the absence of PARC, that means Pakistan, and SARC. And this link, we are working together, and ILRI is taking the lead in bringing all these organizations. And hopefully in 2018, we have a meeting at Kathmandu. We all bring all countries together, and we have taken many decisions. And similarly, this forum will also bringing all the apex bodies like ICR, PARC, NARC, BARC, and SARC together. And it will be a great help to controlling all those diseases. As you know that because of the many porous borders and the cross border approaches, it is very, very essential. And this global network is very, very essential, and will work together. And already our ILRI has given permission us to be the partner of the APAR, and it will take all the essential steps or the essential way how we can go ahead with the APAR for bringing all those network together for bringing these diseases control and spread among the particularly in South Asia, because I'm representing South Asia from ILRI. And it is very, very, thank you, Kay. And this is all about from what I want to speak, because shortage of time.
Dr. Rahman, thank you for those great words of support. We are very excited for ILRI to join the Alliance. This is fantastic news and look forward to collaborating with you. We are now moving to Dr. Alan Rudolph, who's the Executive Vice President for Colorado State University for Research. He's also the lead for the Coalition for Epidemiological Response, Engagement, and Science for Agricultural Biosecurity. Dr. Rudolph, please go ahead.
Thank you, Dr. Vanderhoost, and thank you for the invitation to speak today. As you can see from my background, I speak to you from the Rocky Mountains today, full of snow, but really glad to be here. I want to talk about two concepts that I think are really focused on in the conference on the future, and that's resilience and agility. And Colorado State's a land grant, much like Penn State, and we've had a long history, like many on the call, with regard to the needs for resilience and agility. And our campus, like many in the U.S., has very significant biosecurity practice from discovery to manufacturing. I think for the purposes of today, I'm not going to use my slides because it'll slow us down, but I want to conceptualize them and ask the organizers to feel free to send them around if you're interested in seeing them. The first concept I wanted to talk about is data. Every turn of the cycle with a new infectious disease outbreak, we have more and more data. And what we do with that data is really key to our future of resilience and being more predictive around that data. Many of us in the pandemic have been using it in many ways, but we can use data now to understand better movements of people and animals, the traceability, disease transmission, contact tracing now with digital enhancements is very much upon us, outbreaks and predictions of prevalence. And most importantly, as we face now strain evolution of the current pandemic, being able to predict how these viruses mutate. This is a long-standing program that with our data and high performance computing capabilities, we should make more progress on. The next slide and the next concept I'd like to talk about is the cost of that unit data is dropping dramatically and allows us to do biosurveillance as we've never done before. We're doing now single tests for COVID around the world at anywhere from $50 to $100, depending on what test you're using, if it's PCR. But the cost of that unit information is dropping precipitously, allowing us to multiplex, because most of the diseases we face symptomatically with animals and people are fevers of unknown origin. And we have to differentially diagnose those, and we can't do that with one test. And we have technologies now that allow us with one test to get 30 answers about comorbidities. This slide just shows you how we've been using multiplex testing and this kind of biosurveillance in wastewater. And in COVID, we've learned, I think, we can bring surveillance from a large area or population of animals and humans down to microsurveillance. We've been using it in the US and around the world. It's been used to actually control dormitories and high density residences. Next slide. The third concept I'd like to talk about is transmissibility. We understand so very little about how animals and humans actually get disease because we most of the time strap a nose cone or fill up a syringe and give them that disease, which mimics nothing like what's happening in the world. And we have the ability in our containment facilities and around the world to start studying natural animal models and natural models of how disease is actually transmitted. So we've been able to set up, as others have, mixed ecosystems that mimic barnyards or wet markets and understand the movement of pathogens around these environments, which is a critical step in understanding real world events around pandemics and outbreaks. Next slide. The next concept that I'd like to talk about relates to innovation and what kinds of innovations do we need to be more resilient. We've learned in the COVID that repurposing existing technologies is as impactful as developing a new one. We've taken a benchtop instrument that's capable of removing pathogens from blood and made an instrument that can make a vaccine at the desktop or tabletop, allowing for distributed and agile manufacturing of a countermeasure. We can no longer really rely on centralized facilities to really quickly produce a solution or a countermeasure for a disease. This instrument is being used to make a COVID vaccine, a Rift Valley vaccine, an African swine fever vaccine in collaboration with our colleagues in ILRI in Kenya with Dr. Edokoff. So a demonstration of repurposing existing technology to quickly move it into a solution for today's problems. Next slide. We, as you've heard Dr. Vanderhoost mention, have put a coalition of people with similar assets around biocontainment around the US to really bring our assets together, recognizing, as this conference does, that global interconnections and partnerships are absolutely key. Just as pathogens know no boundaries, we have to work better together on bringing these assets and sharing both data, knowledge, and practice as we move forward to build this resilience and agility. Next slide. And so, like our keynote speaker started with her video, this global infrastructure for pandemic and response is really so key. And, you know, I speak to you from a land-grant institution formed 150 years ago, and we're an educational institution. And so the most promising aspect of what we can do is train our next generation workforce to understand these problems and be able to practice these principles of agility and resilience. Thanks very much for your attention.
Outstanding, Dr. Rudolph. Really insightful, especially fantastic around the technology innovation that is being driven by Colorado State and the impact it may have. Outstanding. So thank you for that. I'm now moving to a special intervention, a very brief remark by Dr. Gyanendra Gongar, who is the Regional Advisor for Food Safety at WHO, Regional Officer for Southeast Asia. Please go ahead.
Thank you very much. First of all, I would like to thank Alliance for Pandemic Preparedness Response to organize this important meeting, workshop. And I am pleased to know that APAR is moving agenda of the One Health India conference held in New Delhi in 2019, which prioritized biosafety and biosecurity as an important area for application of One Health. As WHO's chief scientist reiterated that One Health concept needs to be translated into action. That is, develop working together culture, not only for zoonosis, but also microbial resistance, food safety, climate change, non-communicable diseases like cancer, etc. And biosafety and biosecurity are one of the technical areas of the WHO's joint external evaluation, which is beyond health sector and demands One Health approach at the human-animal interface. It is evident that 75% of the emerging infectious diseases are of animal origin that will continue to emerge in future. I am pleased to note that WHO has been organizing laboratory biosafety and biorisk management training for public health veterinary laboratory professionals in high security animal disease laboratory in Bhopal, India, and promoting joint training of animal health and human health professionals on zoonotic diseases like rabies, leptospirosis, avian influenza, so that they better understand complementarity and added value of working together. Today, biosafety and biosecurity are increasingly recognized as a part of global health security. Thanks to avian influenza crisis at the beginning of this millennium at the human-animal interface, we are able to establish and strengthen epidemiological laboratory capacities, particularly in low and middle income countries, through implementation of avian and pandemic influenza preparedness plan and project. As a result, BSL-3 laboratories have been installed in large number in many countries, and human and animal health sector have recognized that they should work together to deal with emerging high threat pathogens. And today we are better prepared to deal with emerging threat at the human-animal interface, but it is not sufficient and needs reinforcement. In past 1 decade, we are able to detect more new pathogens through better laboratory-based surveillance using more advanced molecular and information technologies. Surprisingly, microbes are also using high tech to challenge us in terms of transmissibility, adaptability, persistence, and vaccine development. And COVID-19 is a classical example. In my note, laboratory needs huge investment and even more to train human resources and sustain and maintain laboratory activities. So it is high time to make best use of available resources and network across the discipline and sector using One Health approach. Thank you.
Thank you for those remarks, Dr. Gongal, much appreciated. We are now reaching to a special session on spillover of infectious disease. And I'm inviting my friend and colleague, Dr. and Professor Peter Hudson, who is the former director of the Huck Institute of Life Sciences, to provide a presentation on this topic. Pete, please go ahead.
Thank you very much, Kai, and good morning, friends and colleagues throughout the world. I just want to start by saying how much I enjoyed Alan Rudolph's points about resilience and agility, and I think that is 100% correct. But despite that, I'm going to focus down on some of the specific issues that I'm asked to talk about, and those are the issues of spillover. And I think we really need an understanding and a framework, and that framework of understanding and insight will really give us that agility, will give us the way forward to look at this. I want to start by making a couple of comments about spillover, and that is many of these recent spillovers are really derived from bats, and obviously the SARS-CoV-2, but also SARS-CoV-1 and a number of other infections are actually derived from bats. And we know, for example, that there's at least 3,000 coronavirus variants recorded in bats. And we know there's a huge high viral diversity there that we have to sort of understand if we're going to get to grips with what is taking place. The process of spillover is relatively straightforward, and I'm sure most of you will know this, because these are pathogens that circulate in reservoir hosts and then spill over, and there's this force of infection, this exposure of humans or to bridging hosts, then act to get the pathogen into the human population. I know we sometimes talk about zoonoses as, these are special events, but really, all of our infections must have come from wildlife at some stage or from domestic animals. So I think this is really a fundamental understanding we need in infectious dynamics. Of course, the approach that we take to this is to try and provide protection, and that is all about prevention. So if you just think for a moment, we prevent exposure through masks and quarantine, we prevent infection through vaccination, we prevent disease through therapeutics and monoclonal antibodies. But what we don't have is we don't have a prevention system for preventing spillover. And we need a framework of understanding to do that. And I'm going to throw some ideas out there to help set this agenda and set us moving. Of course, it is important to appreciate that preventing spillover is very important. Today, we passed the 2.5 million people who had died from COVID-19. That level of human suffering is obviously not acceptable, but that is a huge number. And I sometimes wonder where that's going to end up. Are we going to be looking at 4 million, 5 million dead people? And the economic costs are going to be well over $20 trillion, maybe $28 trillion I've seen as estimates, but this is a huge economic impact. What I want you to appreciate is that spillover is a process. We know it's a percolation process where the reservoir host is carrying the infection, it moves it about, it then exposes it perhaps to intermediate hosts, and then it's passed on to us and things. And there are multiple barriers that it must go through. We have to identify what those critical barriers are and how we can make sure that they're in place to stop spillover. We have to understand why the bats are shedding virus, where and when, and that so lead to exposure of either the bridging host or to humans. We have to understand this role of bridging host, and there's been much discussion of this with COVID-19, but I really think that we have a parsimonious explanation and we don't have the data to go into that in too much detail, but we have to investigate that in much more detail. We have, I think there are issues with the community ecology of the viruses. So in my own studies of bat viruses, we find that they're shedding not just one, but a whole community of viruses when they are shedding. So we have to understand what those drivers are and what the fundamental drivers are taking place. So I think this is a process. I think there are things we can do about it. Just to illustrate it, much of my work, working very closely with my postdoc, Rainer Plowright, is looking at Hendra virus. Why spillover is actually occurring. This is a virus that comes from bats through domestic animals to humans. And we've been able to show that this is because of habitat loss interacting with extreme weather, resulting in nutritionally stressed bats and leading to spillover. So the question we've been asking for many years is how can we predict the next pandemic? And you can't do this unless you have the data. We can do this for Hendra, but you can't do this for diseases like COVID when you don't know about them. The question we should be asking is, how can we refine tools for better pathogen surveillance? And particularly how I think we should be looking at immunological assays. We should be having a global immunological observatory. We should be looking at surveillance of humans and surveillance of hosts and sentinels. And I would favor looking at dogs. Thank you very much, Kai, and thank you very much, my colleagues.
Thank you, Pete, for that very dynamic and insightful talk. We really appreciate it. And yes, good guidance, good vision and direction. Unfortunately, Dr. Surendra Karki from Nepal will not be joining us today. It's very unfortunate, but we will hear from her in the future.
I'm here actually.
He's there.
Oh. Excellent. Excellent. Would you like to make some remarks?
Yeah, sure. Yeah.
Go ahead, please.
Hello, everyone. Good evening, good afternoon, and good morning. First of all, I would like to thank all the organizers for including me in the panel. So as mentioned by Professor Hodgson, we as a human being have already witnessed several disease spillover events even in the past few decades. The current COVID-19 pandemic has further highlighted the global impacts disease spillover events can have in all walks of life. Prior to COVID, we as a human being faced Ebola, SARS, MERS, and Nipah outbreaks, which fortunately did not reach to the level of COVID-19. We are also under continuous threat of zoonotic influenza viruses. Nepal is also considered as one of the hotspots for disease spillover events. The close proximity among wild and domestic animals and human population in Nepal increases the chances of disease spillover events. This is further aggravated by poor biosecurity measures in the farms and limited capacity and preparedness of the government. Considering this, FAO ICTAD Nepal has been working together with the government of Nepal to support improving laboratory and epidemic zoonotic influenza and priority zoonotic disease funded by USAID, as earlier mentioned by Chandra. We work in the principle of prevent, detect, and response. We are also working together with the human health and environmental partners in One Health approach, as majority of our problems are inherently multi-sectoral. Government of Nepal has also endorsed One Health strategy, which needs more funding to make it functional. Finally, I would like to emphasize that disease spillover events can be prevented only through coordinated approach, and we all have a role to play. Resource-limited countries like Nepal needs more support in these initiatives. Thank you.
Thank you, Surendra, for your insights and for sharing. Much appreciated. Now that we are done with this, I'm handing over the reign of the moderator to Dr. Rao to continue on livestock security and health. Sir?
Yes. Thanks, Dr. Kai, that the beautiful session laying some more insight into many issues. I'll start with the session livestock security and health. We have the first speaker, Professor Lisa Bowden, Chair of Population Medicine and Veterinary Public Health, Global Academy of Agriculture and Food Systems, University of Edinburgh. So the floor is yours.
Thank you. Can you hear me okay?
Yes, yes.
Great. I'm just going to put on a quick slide and to see if you can see my screen.
Yes.
Great. I will put it to play.
Yes.
Thank you. Okay, so I wanted to use my opportunity just to highlight, I'm speaking to you from Edinburgh, and I'm based at University of Edinburgh, and I'm a Deputy Director of a consortium called EPIC, which is Scottish Government Centre of Expertise on Animal Disease Outbreaks. And I really wanted to focus on the role of livestock security as a means to improve One Health preparedness. And in that, I really wanted to make three main overarching points or take-home messages when we're thinking about predicting and responding to emergence of spread of new pathogens, particularly emerging pathogens and novel pathogens. Specifically, I wanted to acknowledge the important link really between the security agenda as well as the sustainability agendas and also humanitarian agendas, and where preparedness fits. And some of the other speakers in the sessions have highlighted the importance of agility and flexibility and resilience in that. EPIC is an interesting consortium because it is an important transboundary organization, or a boundary organization where we focus on delivering expertise deliberately to Scottish Government for improving decision making. And I wanted to highlight those links between academia as well as decision makers and stakeholders in that process. Thirdly, I wanted to make the case that so far at the moment we've focused really on technical responses to disease outbreaks and in particular to One Health risks. But I wanted to highlight the importance of including the humanities and the social sciences, and in particular looking at expertise in political and social sciences as part of that structure. So I mentioned already that there's an important link between the sustainability agenda and the security agenda. Of course, as we know that antimicrobial resistance is a huge threat to delivering those sustainable development goals. And I wanted to highlight then under those three sort of points that the opportunities that we have to strengthen One Health through livestock security and an overarching approach. The first is through improving disease preparedness and control by reducing disease burden in both people and animals, by thinking about how we identify the co-benefits and gaps between human and animal surveillance, how people have mentioned already monitoring disease and wildlife trade, and of course the development of technologies like diagnostics and data sharing technologies, as well as remote sensing techniques to improve early warning. But the important part, which is my point 3, is that it's equally important to build that expertise and capacity, not just in the technical sciences when we're delivering human, animal, and environmental health expertise, but also by looking more broadly to multidisciplinary strengths. So I mentioned already before the social and political sciences, and that's important because we need to engage with communities at a local level to be able to communicate those risks to relevant decision makers at scale. And the third point, that one of the things that EPIC does with Scottish Government is engages not just in the short-term emergency response, but also long-term strategic planning when we're in between disease outbreaks or in between pandemics. And that is trying to engage with stakeholders from the outset to explore long-term futures or scenarios, to think about those unknown unknowns and think about strategies that we could put into place which would be able to be resilient in all futures. And lastly, just 3 kind of key points that I wanted to highlight was that we talked about data earlier, and acknowledging and addressing those sources of variability in those data and how we collect and communicate it is of course important. Taking a systems approach, thinking about diverse production systems and market integration and health status, as well as people's behaviors and beliefs, so that we can then communicate a shared vision with stakeholders that links that security and sustainability agenda together. And that, of course, is important to then think about things at a local level in terms of local resource needs, wants, and expectations, so that you can actually consider a multi-sectoral approach. So just in conclusion, just to say thank you for the opportunity to speak, and obviously keen to sort of share and learn from other people's experiences and draw from and I guess contribute really from our experiences in our Centre of Expertise in Scotland. Thank you.
Thanks, Professor Lisa. Actually, the concept of APAR is more or less what you said. I think it gives a confidence to us that we are on the right line. So we'll go to Dr. Beth Bernard, the co-lead infectious diseases senior scientist, ILRI, to share his thoughts on the livestock security and health. Dr. Bet.
Thanks a lot for this opportunity, and I'm really happy and glad to join you. I'm also very thankful for being invited to participate in the talk. So yes, I join my colleagues from ILRI who have given their presentations already, but mine, I'll be very specific on the things we do on One Health. And I'm here working at ILRI as also a team leader for our One Health Center, which Peter mentioned earlier on. So one of the things we do here is to understand the drivers for zoonotic diseases. And the one that specifically comes to mind, thinking of livestock security, is increase in demand for animal source foods. If you look at these graphs, looking from beef to poultry to pork and milk, there's an increased demand for these products across the world, but more so in the developing countries. And this has an influence on changing the livestock production systems as we know. And with those changes, then we face tremendous challenges in maintaining infectious diseases. So of course, we know that zoonotic diseases are really, the rate at which they're emerging and transmitting is increasing with time because of the changes in these production systems, but also with many other things, including improving climate change, fragmentation of habitats, and all these global drivers. The figures I'm showing here, of course, has been mentioned by other presenters about increasing emergence of infectious diseases. There is also a report from World Health Organization showing that most of the zoonoses that we know of are transmitted through food, and their burden is very much equivalent to most of these major diseases like malaria, TB, and AIDS. The main point that we also want to make is prevention is better than cure. That's an old adage, but we know, for example, in COVID, if we invest just some few $1 billion, you're actually likely to reduce the burden of disease going forward. So I want to highlight what Dita mentioned earlier on, that we have developed a One Health program here within ILRI that focuses on 4 main thematic areas, including emerging infectious diseases, neglected zoonosis, food safety, and AMR. I'll just focus on the first 3, and my colleague, I think, will be talking about AMR in a short while. But our entry point at ILRI is really working in livestock, as well as in livestock-wildlife interfaces. And this is building on the work that has been done over many, many years on environment, looking at interfaces between livestock and wildlife, but also looking at systems approaches to addressing livestock production and health. So the One Health program has 3 main pillars. The first is, of course, technical, which looks at ways of controlling diseases. The second is institutional, looking at how to build institutions in developing countries on how to manage One Health issues. And lastly, policy, to drive those institutions into implementing structures that supports disease control. I want just to give you 3 examples of what we do on the ground, because we work with decision makers, we work with people, communities, and we work with governments. And the first one is on anthrax, which is a common disease in the developing countries. We do lots of biosurveillance, as well as mapping, and also training. So the disease is caused by rod-shaped Bacillus anthracis bacterium, which we examine in our labs here at ILRI, which Dita mentioned already. I don't want to go there. And we do lots of surveillance in livestock, wildlife, and also humans. But I think of interest to this discussion is the training that we offer what we call frontline workers. So we train them on biosecurity, biosafety measures, as well as how to dispose carcasses which die from this disease, so as to prevent further transmission of infections. The next example I want to give you is on what we're calling examining multiple burden of disease. So we know in developing countries, it's areas that we visit are quite sparse. It's very expensive to get to the field, and it will be much more cost effective if you studied multiple diseases at the same time. So for example, we have a project with DITRA, which looks at multiple pathogens, and we use sequencing and bioinformatics to see how those pathogens get transmitted from wildlife to people, to livestock and people. We have another project looking at delivering vaccines for multiple diseases, because we know if you just go to the field and you are to do one vaccination campaign, let's say for PPR, and come back to your station, it will really not be that cost effective. So what we do is we try to bundle vaccines and try to really benefit from that approach. So lastly is to show you that we have another project on food safety, and we do bushmeat value chain analysis, we do informal value chain assessments, as well as capacity building along those informal value chains. Last but not least is we have been working in sub-Saharan Africa to look at One Health networks, and we now have a directory that we can go back to and try to engage, train, and do research with multiple teams in this region. So let me stop there just to show that we have many partners, including donors and governments. So thank you so much.
Thank you, Dr. Bernard. In fact, it was very nice to hear all the programs that ILRI is doing. And I will switch on to USDA. Dr. Joseph is there. He's the Agency Biosafety Officer, Animal Productions and Protection, United States Department of Agriculture. Yeah, over to Joseph. Yes. Can you?
Well, thank you. I'm going to try to share my screen. So,
okay.
Okay.
You want us to share, or you will share?
If you can see my slides, yeah, hopefully
okay.
you can see it. All right. So again, thank you for allowing me the opportunity to come and share some thoughts on what topics should be covered in the One Health Veterinary Biological Safety and Security Summit. I probably am looking at this a little differently than many of you, because I am a biosafety professional. I've had about 30 years in the field. I've been with the USDA for about the past 16 years. The agency that I work with, the Agricultural Research Service, we have a mission of solving scientific problems for agriculture, and with a farm to fork scope. So we have a lot of facilities, close to 100 different facilities, including a number of high containment facilities, and soon to have one maximum containment facility in Manhattan, Kansas. So we have some capabilities, and biosafety and biosecurity tends to be a topic that is very near and dear to us, as well as is the topic of One Health. In fact, earlier this month, I had the opportunity to serve as the chairman for the 6th International USDA ARS 6th International Biosafety and Biocontainment Symposium, which really has a One Health mission. So some of the topics that we covered in that particular symposium held earlier this month were, we had a half-day session on African swine fever, a half-day topic on the need for applied biosafety research. And that's something I'd like to also discuss a little bit here today with you all. Also, we had a full day covering the impacts of SARS-CoV-2 and COVID-19, with a specific look at impacts on agriculture, food security, those types of issues. And then we went into you can't have anything, a biosafety conference without discussing risk assessment. So we had a session on that, as well as a large panel discussion on biosecurity, where we looked at everything from cybersecurity issues to physical security to your traditional laboratory biosecurity. But I wanted to talk a little bit about some topics that I think that should be considered. Disinfection, decontamination, inactivation, methods for transboundary animal diseases for both a laboratory setting and in field, where you're going to be dealing with different matrices. In the laboratories, you tend to have easily cleanable surfaces. In the field, that is not the case. So one of the things I think that is a challenge is the need for effective disinfectants for cleaning infected premises, trucks and fomites, to prevent transboundary animal disease transmission. I think as we saw from our high path avian influenza outbreak a few years ago, is that there's a large possibility that individuals and vehicles and the disease can be transmitted by human action. And one of the things that I think that is also a challenge is validating, having validated agent and activation methods that would allow for scientific use. So it would be able to inactivate the agent to bring it out of a higher containment level to a lower containment level to be manipulated safely. I also think that depopulation and carcass disposal methods during an outbreak situation is a topic that could use some attention at a meeting like this. The USDA APHIS maintains a dashboard on carcass disposal and provides options for planning purposes. Our National Animal Health Emergency Management System guidelines provide SOPs covering 23 different critical activities such as depopulation, cleaning, and biosecurity that are key to effective preparedness, especially for a transboundary animal disease outbreak. I think one issue, and we had covered this topic with at the ARS symposium earlier this month, was transmission and environmental stability of transboundary animal disease, especially as it relates to transmission via feed. We actually had some of our colleagues from Kansas State University who had conducted a study on the half-life of African swine fever virus in shipped feed. I think that's something to consider. We've also had some experience, relative to Weissella outbreak, where it seems feed was also a method of transmission of disease in farm trout. So one of the things that I'm involved in co-chairing with colleagues from the U.S. State Department is that we had a federal stakeholders workshop on applied biosafety. As you're aware, science changes. Having research programs that focus on applied biosafety issues has not necessarily kept pace. And there's been several US government reports recommending the need for establishing applied biosafety research programs to provide evidence base relative to biosafety practices, facility designs, disinfection procedures, the whole route. So one of the big gap areas, we identified 5 categories of relevant research which needs to be addressed: the evidence-based evaluation of elements within the hierarchy of control, scientific basis to prevent pathogen exposure and infection, the empirical basis for incidents such as human factors and equipment reliabilities. This is especially an issue in laboratories, both veterinary and biological. Evaluation of our risk assessment and management methods, and sociology of laboratory biorisk management. How do you install that, that positive biosafety culture within an institution? To give you an idea of what we meant, the evidence base with the evaluation of elements within the hierarchy of control, this includes everything from the traditional industrial hygiene pyramid, from elimination through PPE. So some of these issues relative to introduction of new scientific equipment, what risks are being introduced, what engineering controls are we able to utilize? I know in developing countries that becomes an issue. For example, receiving parts and certification services for biosafety cabinets. Looking at the scientific basis to prevent pathogen exposure and infection. I think that is definitely something that needs to be taken a look at, because you can't do an adequate risk assessment unless you really know, the elements of the pathogen. So identifying those risks and the success of mitigation measures that we're putting into place. And then this was just my last slide, and I'll close my comments there. Is, you know, there is not a whole lot of research on what are the human factors when we go into a laboratory environment, especially like in a high containment. What are the impacts of fatigue, muscle memory? You know, most everything that we do in a laboratory are essentially fluid transfer, fine motor skill. Movements. What are those impacts on the potential for either laboratory acquired illnesses or releases? And evaluation of the risk assessment and management methods, I think, is pretty key as well. Many cases we use qualitative systems. There might be a way to move towards a more quantitative methods going forward. And with that, I think I'll end my comments. Thank you for the opportunity.
Thanks. Thanks, Dr. Joseph. Actually, sociology of laboratory management is a very interesting concept. I think we'll move on to Dr. Arshni Moodle, again back to ILRI, Africa. He belongs to AMR team lead and AMR hub hosted by Africa. Dr. Arshni Moodle.
Yes, I'm just about to share my screen. I hope you will be able to.
Yes, we can see.
Excellent. So thank you very much for inviting me to be able to share with you a bit of the work that we're doing at the Antimicrobial Resistance Hub, which is hosted and led by ILRI. So this is a hub that was established in 2019, and you know, to address antimicrobial resistance. And antimicrobial resistance has really come up a lot already in our discussions today. So it is a platform to convene different stakeholders within the AMR space to identify gaps, generate evidence, and ultimately to inform context-specific interventions that will support low and middle income countries in controlling agricultural associated AMR risks. And I think the important word is that it has to be context relevant interventions that need to be cost effective and sustainable among smallholder livestock farmers in the global South, as well as, you know, they make up this informal sector, and how do we address that informal sector with the interventions that we're doing. So the hub is essentially formed with the partners mentioned on the left, which is 4 CG centers and 2 of our key research partners. But these are not only the people we work with, and I'll show you a slide at the end with some of our many partners. And the hub's work is divided into 5 pillars to try to address different facets of antimicrobial resistance, and then because it's such a complex issue, what can we do about it in terms of addressing that? I love this slide. It's one of my favorite slides because I think it shows the complexity of AMR and how interventions really need to take into consideration the different sectors and how they are linked to each other. And what I've tried to highlight with this slide is also the different areas within AMR One Health that we're trying to address in a low and middle income context here with our different partners. These are our project activities where we're doing different projects around the world. And also, you know, some of our major work is really trying to understand what are the drivers of use, why are farmers using the antibiotics or antimicrobial, should we really say, how are they accessing that in order to be able to understand, well, what do we need in order to reduce use if use is a big driver of resistance? One of the other things is that in order to really make a case for an investment in AMR, you need to show that it is really a problem. And how do we show that in terms of generating numbers in contexts in which we do not have that? So this is really to try to understand AMR prevalence and how is it being transmitted in these very special contexts that we find ourselves in low and middle income country. We also know that some of the resources that we face in terms of gaps or limitations is people and time and skills. So how do do we address that? And that's what we're trying to address in part of our capacity development. And this is also laboratory diagnostics. The labs here are usually under-resourced in terms of equipment, various what would be small things in a high-income country, but truly a major impact here. So if we want to be able to say anything about how do we treat an animal, we need to be able to know what is causing that infection, and if that infection or that particular organism is going to respond to whatever treatment we want to give. And then I really want to bring over, kind of stress these interventions is that they need to have a cost benefit. So a smallholder farmer who has very little income, we want him to behave in a way that is, that promotes rational use. What does that mean in the context where we don't have access to a veterinarian or veterinary services, where it's under-regulated, or there is regulation, but it's not implemented because of various other conditions? So how do we address that? And how can we in the countries in which we're working in? We're also looking at crops, because we know that one thing is livestock, but crops, especially from the livestock, in that the use of manure, what is then the impact or downstream when we use them as fertilizers in crop, and then what ends up in the human as part of human consumption. And also as the environment as a strong a reservoir of resistance, what are we doing there when we just dump, when we don't have good manure management practices in low and middle income countries? What do we do, and what are the impacts of that? The other thing is wildlife. Bernadette has talked about that, is really to try to understand, well, what do wildlife, I think, are incredibly unique or interesting group of animals or an ecological niche to study, because they have this migration with them, so they can carry antimicrobial resistance from different parts within a country. They also pick up, I think they're a reflection of what is happening in the environment, and how can we study that and include that in the work that we're doing here. This is just a kind of an overview of all of the different projects, is to show that we invest a lot because we believe. We also see benefits. We want there to be benefits within this, within addressing AMR. And so we're trying to do, as much as possible within the sort of the space that we have to try to address it, generate the evidence, test interventions, working with national governments, looking at policies, what is gender and the role of gender in agriculture and AMR in terms of the interventions, and as I said, capacity development. One of the things that I think is unfortunate is that when we study the impacts of AMR, we tend to study agricultural use and the impacts on human health. And what we fail to address, or we're not addressing enough, is the impact or burden of AMR in livestock production, in terms of what is the level of resistance in livestock pathogens that really comes back to us and sort of says, well, what does that mean in terms of output or production losses? So I think the World Bank was really good at trying to look at that. What would be and they show in their sort of simulation models, what will be the impact of AMR on livestock production, and showing an a decrease in output in a high impact scenario of up to 11%. And what does that mean for food systems, livelihoods of people? I think that is something that we need to focus on. And even in high income countries, they themselves also recognize that we don't really know a lot about resistance in animal pathogens, breakpoints, treatments, and things like that. And I think there is a definite role of focusing on livestock health and AMR, because we tend to be focused on human health and human health impacts, unfortunately. As I said, we work with many different people. It's really not us alone, and we'll never be able to do this because of AMR, One Health, complexity. We need so many people at the table, and we're really fortunate to have really great partners in country, at the national government level, ministries, as well as the farmers on the ground. So we try to work with as many people, because we realize that we can't do things alone. So I'm extremely grateful for all our partners in our hub. And that's really what I wanted to say about AMR and why I think is incredibly important. This is the link to our website if you want to have more information. And we're always happy to work with anybody who has an interest in AMR. And if we can collaborate, I would be very happy about that. So thank you very much.
Thanks, Dr. Ashni, for this great treatment on AMR. I think we will move on to Dr. Solomon, Senior Researcher and Head of PMO Ethiopia, NAHDIC. Dr. Solomon, are you there? Dr. Solomon? Yes, please. Please unmute. Hello? Hello? Can you unmute? Hello? We can't hear you. Dr. Solomon? Muted. Hello? So we'll get back later. I think we'll go to Professor Neil Sarikson, Chair of Farm Animal Practice, Royal School of Veterinary Studies, University of Edinburgh. Professor Neil Surgan. Professor Neil.
Hello, I'd like to share my screen with you. I hope this is working. We all know that improved production efficiency from all classes of livestock is essential in meeting each of the United Nations Sustainable Development Goals. I'm going to focus as my example on the role of sheep and goats in integrated agricultural systems. These animals, shown here in Pakistan and in Uganda, are remarkable in their versatility to different production systems, their efficiency in metabolizing poor quality herbage, their manageable size, relatively low maintenance requirements per unit of output. They're adaptable to convert poor quality forage to food and therefore ideally suited to resource poor regions. They have low capital investment, short generation intervals, are useful as economic reserves, and are resilient to disaster. Time doesn't permit me to explain these images of small ruminant production in rural, peri-urban and urban environments in Malawi, India and Pakistan. But they all show the importance of these and how they integrate with the United Nations Sustainable Development Goals. This potential of small ruminants as a means of alleviating poverty is well recognized in low middle income countries and has underpinned a range of programs. For example, the Pass It On goat schemes in Malawi, Goats for the Poor in Pakistan, and various 4 goat schemes in southern India. But we do need to ask questions about the effectiveness, efficiency, welfare friendliness, and economic and environmental sustainability of these programs. These programs have shown that small ruminant production can be a solution to sustainable food security and poverty alleviation. But we also know that globally, small ruminant production is utterly inefficient and woefully inadequate in the context of meeting these sustainable development goals. And we know, and it's been mentioned already, that there are numerous reasons for that, and we cannot address any of these challenges independently of each other. We have to address them all at the same time. Many schemes aimed at better livestock production efficiency in low middle income countries have failed, because they take solutions that work in developed agriculture economies and regions and then apply them in the wrong animal health, political, environmental, or social context. So rather than taking that approach, we need a focused, iterative, planned approach to health management of these animals within the environment that they're kept in. That animal health management approach affords both an immediate opportunity for improved production efficiency, but is also key in identifying research priorities and those areas that we need to look at in greater detail. And this image here of a statue outside a vet school in Kerala in southern India shows just how important this is for us to adopt these approaches. It shows the importance of these small ruminants to tribal communities in that area. The approach that we've taken has involved this animal health planning management. And what it's showed us is what the interlinked topics that need to be addressed are. And the primary topics that need to be addressed to help, for example, these Pakistani shepherds are combined nutritional and reproductive management, perinatal husbandry and care, housing management, zoonoses and public health, and transboundary diseases. These areas must be addressed first before we can even start to instigate longer-term solutions involving, for instance, genetic improvement, which is so needed, antimicrobial resistance management, which is also needed, and perhaps more importantly still, in the context of these Pakistani farmers, anti-parasitic drug resistance management. Thank you, and that's my perspective of the topic.
Thanks, Professor Neil. Actually, that was a very succinct presentation about farm animal practice and management. A lot of lessons to learn from your examples. This Dr. Solomon is ready. Dr. Solomon? Dr. Solomon, are you ready? Hello? Hello? We can't hear you. Hello? Okay, I think he's still, there is a technical problem. We will switch on over to Dr. Melinda Wilkins, Associate Professor, One Health, Penn State University, College of Veterinary Medicine. Professor Melinda.
Dr. Rao, we received a note yesterday late evening that will not be able to.
In that case, we'll move on. I think she has excused herself because of some work, and we'll move on to special interventions. These are basically for 2 to 3 minutes, and I'll request Dr. Meera Prajapati, veterinary scientist, Nepal Agriculture Research Council, to join the interventions. Dr. Meera?
Hello, thank you, Dr. Rao.
Yes, please, go ahead.
Hello, everybody, and warm greetings to all the respected persons present here. This is me, Meera Prajapati. Of course, biosafety and biosecurity is very important to minimize the entry and spread of infectious agents. I have outlined some major areas where we still find gaps and challenges in terms of biosafety and biosecurity. They include management practices, import and export system at borders, and research and development. In management practices, we have found substandard or low fencing sets of animals. There is no any practice of farm registration, animal identification and traceability system, no any quarantine measures while introducing new animals, and inappropriate practice of waste and manure management. At borders, risk analysis methods is not implemented properly in importation of livestock and livestock products, ineffective implementation of border quarantine and testing facilities. On the other hand, there is poor research and surveillance on emerging and re-emerging diseases, AMR, there is poor lab facilities and human resources. So to overcome these gaps, we need to raise awareness about biosafety and biosecurity, enforce existing rules and regulation, modest enforcement of the control and compliance system. We need to strengthen the research and surveillance of emerging diseases, AMR, and promote basic research of pathogens, including genetic analysis, vaccine for prevention and control, improve diagnosis technology, and information network and drug therapy. We also, our organization also have done surveillance on Nipah virus, antibiotic resistance, and we need to continue that. So measures to control animal health will definitely decrease the spread of disease to human health. So it is very important. With these things, I would like to thank the organizing committee for providing me this opportunity, and I wish the success of this workshop. Thank you very much.
Thanks, Dr. Meera. I think that was a good intervention of points relevant to all of us. I think Dr. Solomon is online again. Dr. Solomon, can you hear me? I think We lost him. So we'll go to Dr. Moore Siobhan, Team Lead, Livestock Health, Ilri, Ethiopia. Back to Ilri. Dr. Moore?
Dr. Rao, she will not be joining. She's in the field and has sent her apologies.
Okay. So, Solomon, can you speak now?
Yeah, can you hear me now?
Yeah, yes, please. Maybe about 3 minutes or so. Yeah, please go ahead.
Okay. Sorry for inconvenience.
No problem.
Okay. I'm Solomon Gabriel from Ethiopia. And as you know, Ethiopia has Africa's largest population, and approximately 80% of its population is dependent on agriculture and have direct contact with livestock or other domestic animals. As such, the work of One Health to prevent zoonotic disease is so vital. Animal disease also have an important impact on human health, with 60% of human disease being of animal origin. Ethiopia is endemic to a wide range of such zoonotic diseases. In the past 2 decades, emerging and emerging zoonotic diseases have acquired global significance for veterinary public health. And I am working in Ministry of Agriculture, and my place of work is National Animal Health Diagnostic and Investigation Center. This is a federal veterinary laboratory, and the country has also 50 regional veterinary laboratories. But since I attended the One Health conference in Australia, my center has opened work on this subject. Because of that, One Health approach strategy has been worked out in the country, and we are working in collaboration with many international partners to reduce the epidemic and outbreaks in the country. And I take this opportunity to thank all development partners, especially the FAO, OIE, CDC, DTRA, BTRP, and African Union, APAR, IGAD, and from the universities, the Pennsylvania State University and Cambridge universities, and all these partners really helped our institutions really to do the job properly. Currently, we have a biosafety level 3 laboratory, and our lab is doing a very nice work to help all livestock diseases in the country. And as One Health approach, we have a very nice project with Pennsylvania State University on bovine tuberculosis, and with DTRA BTRP on key fever. And we have also a very nice program with DTRA on biosafety and biosecurity. And this project is active since 2020, and it is going on. And we are working also on antimicrobial resistance with FAO. And in this regard, I think the work so far conducted in our laboratory is very, very encouraging. I like to thank, I prepared really in very good manner, but I think the time is short. I think I take this opportunity to say only, I think the collaboration must be strengthened. And when the COVID-19 pandemic declared in Ethiopia, the only 2 laboratories in the country doing COVID pandemic laboratory analysis was my laboratory. And now, because of capacity building, more than 60 laboratories are currently doing COVID-19 works in the country. Because of that, I really appreciate all development partners who supported our institution to do all zoonotic diseases. And thank you very much for your attention.
Yeah, Professor Solomon, sorry for that, the time is limited, but I think we heard that you have contributed very greatly in the diagnosis and also capacity building. We'll get back to you when the larger conference is there. We'll give you more different platform for your talk. And I'll close this session here on livestock security and health. We got enough inputs for setting priorities for the major workshop, major conference that we are planning in future. I will hand over to Dr. Kai from Penn State to moderate from here, from session 4. Dr. Kai, over to you.
Thank you, Dr. Rao, much appreciated. What an exciting and insightful session. I really enjoyed it. I will be moderating session 4 and 5, focusing initially on technology innovation, opportunities and risk, followed by critical challenges on surveillance, diagnostics, and laboratory operations. So I will ask Dr. Bruce Whitelaw, Professor of Animal Biotechnology at the Roslin Center of the University of Edinburgh, to open the session. Dr. Bruce, would you like to start?
Thank you very much, Kay, and also to SR for the invitation to come and speak to this august crowd today. I don't have any slides. I have one single plea, which I'll get to. We've heard about a glorious amount of activity internationally with regards to the challenges and aspects of One Health, which we're all passionate about. We've heard about facilities, networks, the many partnerships which are required, and indeed the fact that this has to be multidisciplinary in the true sense of the word if we're going to progress. My plea is that in amongst all this, we need to fuel innovation, we need to fuel enterprise and entrepreneurship. We rely heavily on governments, we rely heavily on public funds to make this work across the globe. We can, by fueling an enterprise environment, and I'll get to that in a minute, I think we had a very strong extra bow to our fiddle to get accelerate the translation of the wonderful science through to the market. So my plea is we need to craft a culture around One Health for enterprise. Now, there are really exciting opportunities. I'm not going to list them. I'm sure many of you are either already engaged in them or very clear in your own mind what they are. These opportunities give us better prediction, all goals that we want. I would highlight one, and that is we really need to embrace genomics. We need to embrace the power of DNA sequencing and so forth. I think we can all see opportunities for on-farm tools in that regard. Should we be thinking about in-animal tools in that regard? And I know that some of the big sequencing companies are working in that direction. If you speak to them, they'll tell us that in 5 years, they'll have those tools. We should be now putting in place the right environment to allow a culture of enterprise and innovation to capitalize on that. We should be looking at alternatives to vaccines. These are obvious points. We should be looking at alternatives to vaccines and antibiotics. And I know there's an awful lot of academic industry, academic effort in that regard. But again, we should fuel the environment of the entrepreneur. And finally, data. We've heard it mentioned a few times by several colleagues today. I would say anything and everything to do with data is on the cards for One Health, and it is the future. We can do an awful lot within the academic environment, but we need to fuel the enterprise culture. What I mean by that is not just simply adding a couple of courses onto our academic curriculum to teach the next or upskill the community. We really need to embrace the whole thing from engendering into our students, into our colleagues, the idea that entrepreneurship, that innovation, that new commercial activity is a way of fueling the whole space. Now, we in Edinburgh, especially at Easter Bush, have built up what we believe is the start of such a culture. We have a variety of activities going all the way through from at the top end, I suppose, forming and hosting spin-outs and startups, all the way through to a whole variety of activities for both undergraduate, postgraduate, but also now starting to reach out into the local community. And we should all do this in all our places around the world. And I would say that in addition to the efforts that we have already within the straightforward academic community, we need a parallel, equally scaled innovation enterprise pipeline. I won't go any further, but just to reiterate my plea, when you come to the workshop, you want to have a session on how do we fuel that enterprise culture. And I'll stop there, Kay.
Bruce, that was actually quite insightful, I think. Excellent. Building that entrepreneurship, building that generation of innovation, and building the workforce around it is a key point. And I think Dr. Bijou Jacob, who is the director of United Nations Health Innovation Exchange Program, will actually dovetail very nicely with his comments into your observation. Bijou, are you online?
Oh, yes, Kai. Thank you so much, Kai, and all the organizers of this wonderful event. Very timely and amazing job you're doing, putting together such an illustrious group on such a topic. So I represent UNAIDS Health Innovation Exchange, and most of my work is around the human health. And now the pandemics have made it very clear, or send message to everyone, though people acting on the governance side and policy side on the larger organizations. We're working towards the One Health format, but the necessity of that is something which has become very clear to the civil society after such an unfortunate event. So it's quite timely, and when people are sensitized on this, to kind of make interventions. So I see the program is very relevant. So in the regular pandemic or epidemic preparedness and response side of activities, the program which I work in Health Innovation Exchange is mostly working towards a new approach rather than the regular format of larger government or philanthropic organizations do, which is a programmatic approach of solving such kind of programs, where they look at capacity building or any of those activities more taken in a perspective where it is granted that this kind of pandemic preparedness and response kind of activities are responsibility of government, international organization, not profit. What we are trying to do in Health Innovation Exchange is coming in the same line of thought, which Professor Bruce just mentioned. How do we look at investing in mission-driven social entrepreneurs or private sector players and facilitate and mediate them building this system or ecosystem favorable for them, or we call it in business sense, market shaping activities, and facilitate investment on social entrepreneurs, making it like a sustainable program towards pandemic preparedness or this kind of area. So put it in other words, if you look at, if the venture capitalist or investment firms could go to a level where Mars mission to space technologies have become very lucrative, something like the pandemics which hit each and every one in this earth, why can't we do market shaping exercise for making that kind of technology investable? Why can't we make it the fabric of the society where we can probably better prepare, we can probably better reduce the incidents and things like that. So working it out from a top-down approach, looking from existing, low-hanging opportunities, looking at AMRs or looking at other potential infections which has got chances of mutating and making more complicated infections. Starting from there, moving down till the kind of the transition phase of zoonosis kind of area is something which we are looking at, mobilizing venture funding, mobilizing philanthropic capital. So that's the kind of work which we do. And I think if we center our focus around a few of the critical areas like vaccines, therapeutics, diagnostics, the preventions, especially the digital health models of epidemiology, contract tracing to communication systems, or like Professor Bruce mentioned about looking at genomics and technologies like that, and tagging and tracking sporadic infections, tracking down the source, informing at the earliest, doing rapid vaccine prototyping. So if you could actually create a market shaping mechanism where such kind of investments can be made, sustainable business opportunity or ecosystem can be made for generally in the veterinary science area, the food and agriculture area, going up till the direct human health. The coming years, that is something if we can focus, create a mechanism that can really make a difference. So that's something which we believe. And whatever learnings which we have from the human health and the area where we are promoting that kind of approach, would be happy to work together and see how we can make a difference here. Now that's all for my thought, but we'd like to have offline continued conversations before the major event and see, even looking at probably we could look at some blended finance mechanisms or the mechanisms with which global fund has been able to make difference in HIV, malaria, TB, or market shaping mechanisms like Gavi or CEPI in in the vaccines discovery, translation, and production. So we could do that in low end technology, digital technologies, which is community driven, to together fight and resist more pandemic not to be coming in, and better prepared on the response. So I pause here. Thank you once again for the opportunity.
Thank you very much, Bijou. And again, Bruce, I did not expect that you would both be focusing on driving innovation through creating market spaces. This is quite fascinating and a very unique perspective. And I hope that both of you will participate in the workshop planning, actually the symposia planning, and help us think through that and expand on that discussion. We're now moving to special intervention on a national perspective of innovation to Dr. Shaheen Alam, who is a senior scientific officer of the Bangladesh Livestock Research Institute. Dr. Alam, would you please take the floor? Dr. Alam, are you there? Dr. Alam? He did.
Hello everyone, sir. Thank you very much. So first of all, I would like to thank the organizer and co-organizer, or directly or indirectly involved, those who are involved in this program, because actually this is my new experience. So I joined this program today, especially my expectation was I have learned a lot from this discussion, scientific discussion. Actually, as we know, technology innovation, opportunities and risk are the very important issue regarding smooth and proper use of any developed technology, that is especially in field condition. In context of Bangladesh, I would like to say, as we know, PPR is the one transboundary animal disease. Just I would like to explain one disease like PPR. We have the vaccine, PPR vaccine. Now we have the total goat population near about 26 million. So here I would like to draw the attention. We have the PPR vaccine, but We are using this vaccine in field condition, but we cannot maintain the proper cool chain. That's why here is one intervention. We need one intervention. How we can produce this vaccine in context of our country. That means thermostable PPR. We need to develop thermostable PPR vaccine to control these diseases. Especially, this is the very vital and important diseases in Bangladesh. As we know, we are the people of developing country, and PPR, especially this is the dangerous disease in my country context. And most of the remote area people, they are hearing this PPR. So one of the important intervention to prevent this disease is to develop the thermostable vaccine. We have the PPR vaccine. Another important issue here today, I have learned a lot regarding zoonotic disease, AMR, then biosecurity. Finally, I'd like to say One Health approach. So as we are the people of developing country, so we would like to talk about the One Health approach, because we know the One Health approach is the relationship between human, animal, and environmental health, and applies the interdisciplinary tool to solve the complex public health problems. Actually, our ultimate goal to keep the public health good. So if we would like to keep the public health good, so we would like to prevent the infectious diseases, especially zoonotic diseases. As we know, every year 5 new human diseases are coming from animal. This is reported by OIE, and among them 75% of infectious diseases are coming from animal. Human infectious diseases are coming from animal. So our target, our attention should be how to prevent these diseases, how to prevent or how to spread these diseases. So I think that biosecurity is the first line's defense to prevent of any kind of infectious diseases. So as we are the people of developing country or poorly developed country, so we are working on biosecurity. Especially our government has the emphasis on biosecurity related program, especially awareness build up. That means training program regarding to biosecurity. Another, yes, please.
1 more minute, sir.
So another important issue that is AMR. AMR is the big issue now in my country context, because we are using antibiotic, especially in broiler. Suppose at the end of the day, that is when farmer is going to sell the bird, even they are using their antibiotic at the end of the day, just before selling the bird. So this is the very important burning issue in my country. Not only that, we are trying to mitigate this problem because there are many training programs our government are arranging to solve this problem. So here I would like to say regional cooperation we have, but we also need to we also have the international collaboration, the cooperation. So we also would like to maintain collaboration nationally as well as internationally, and we also expect proper training program, lab facilities, especially as we know, pandemic COVID situation. We also face this problem in my country, and our government also try to mitigate this problem. As our colleague has already mentioned, near about 100 laboratory have diagnosed this COVID virus. So actually we are fighting to solve any kinds of problems. So I would expect the donor agency or other international agency contribution to solve or to mitigate any emerging or any zoonotic disease problem when it's spread in Bangladesh. Thank you very much.
So thank you, Dr. Alam. This was actually quite interesting from a perspective that I know that a lot of the colleagues we have online here today, whether it's from the Institute for Animal Health and Veterinary Biologicals in Bangalore, or whether it's our colleagues in Addis Ababa at NADIC, they're all dealing with the same type of challenges that you're just describing in terms of vaccine production and therapeutic production. So I think there's great opportunities through APAR and through this network to share lessons learned and to build upon what has been developed and how we can jointly collaborate to make progress. So thank you for that.
Thank you very much.
I'm moving on to the next session on pathogen surveillance, diagnostic, and laboratory operations and capacities. Unfortunately, Dr. Kuchipudi will not be able to join us and sends his regards, but will be actively engaged in the planning of the future symposium. So I am now moving directly to Dr. Venkatesh, who is the principal scientist of the National Institute for High Security Animal Diseases in Bhopal, India. Thank you so much, Dr. Venkatesh. Please go ahead.
Thank you very much.
Dr. Venkatesh?
Yeah. Hello, everyone. I thank Dr. Rao and Professor K for this opportunity. So I'll be talking about this pathogen surveillance, diagnostics, and laboratory operations from ICR Nishad's perspective. So our major mandate is to conduct basic and strategic research on exotic, emerging, and re-emerging animal diseases, and biorisk management and capacity building in the areas of biosafety, biosecurity, and biocontainment. We have research programs majorly on development of diagnostics and vaccines. We have we maintain this repository maintenance, and we go for pathogen characterization and host pathogen interaction. Am I audible? Actually, here the power is
Yes,
gone.
yes.
Yeah.
There's a disturbance, but of course.
Yeah. Suddenly, I do not know. So, oh God. Maybe I'll try. So again, we have like in India, we have this preparedness to combat exotic diseases in with actually coordination from three three people. The state animal husbandry departments, they report the new clinical events. They collect samples through DI labs and regional disease diagnostic laboratories, and they are sent to us at Nishad. So we have already diagnostic preparedness, and we also do active and passive surveillance. The policies, they are made by the Department of Animal Husbandry and Dairy, and contingency plans. Nishad also, they are also involved, but it's being notified by the DADF, and they form this rapid response teams. Apart from this, for all the endemic some of the transborn animal diseases, Indian Veterinary Research Institute and veterinary universities, they take an active part in doing research as well as in diagnosis. And this Nivedi, ICR Nivedi, they do the sampling framework, and NRC Equine, they do the work on equine diseases, and Directorate of FMD, ICR Directorate of FMD, they concentrate on FMD research and diagnosis. So this is the long list of diseases for which Nishad, they are providing referral diagnosis. So DADF, actually they have recognized as Nishad as a referral laboratory for this many diseases, right from avian influenza, swine influenza, and so many other diseases. So the facilities, we have BSL-3 facility. The lab was started functioning in 1998. It was dedicated to the nation in year 2000. Actually, initially the lab was categorized as a BSL-4 laboratory, but with latest updated standards, now it doesn't conform to some of the aspects of BSL-4, so you can call it little more than BSL-3. And we have other added facility, like we have a SPF unit, specific pathogen-free unit to cater to our needs. Then we have a transmission electron microscope. We have sequencing facility, flow cytometer facility, and other research facilities. We have an animal biocontainment facility, which can be categorized as ABSL-4. We have a facility for conducting experiments on lab animals, small animals, large animals, and we have got isolators for conducting experiments on poultry. So we have, since its inception, NISHAD has been playing a role in preventing entry or spread of exotic and emerging diseases. We have, NISHAD has played a pivotal role in highly pathogenic, in diagnosis and of highly pathogenic avian influenza since 2006. Thus, colloquially, it was called as avian influenza laboratory or Bhopal laboratory. The lab has been recognized as a OEE reference laboratory, and since then, upward linkages with OEE has been maintained, and we have been participating in OFFLU proficiency testing, and we are providing, we had provided diagnosis of avian influenza and clinical sample from neighboring countries also. The lab has been accredited for ISO 17025 to 2017. And apart from avian influenza, we are doing research on a very long list of diseases. So 2020, like for in human, we had COVID-19. In animals, we had two outbreak of two diseases for the first time in India, African swine fever, for which we had prepared, diagnostic preparedness was achieved in 2018. And we have been participating in PT programs since 2018. And we were, because of that, we were able to provide when the samples were received here. During this COVID, even like this transport was stopped, but by a special flight, the samples from Assam, they were sent here. We could provide within, including sequencing, we could do it within 3 days, and we could isolate it in 4 days. PRRSV, it was first diagnosed in 2013, for which diagnostic preparedness was in 2006. We have also done diagnosis of pandemic H1N1, again lumpy skin diseases in 2020. Apart from that, we have been doing research and diagnosis since more than a decade in BVDV, BD, MCF.
Sir, you're running out of time. Yeah, one more minute.
Okay. And like that, we have been providing services to AQCS. We have also involved in COVID-2 diagnosis of human samples, development of diagnostics for animals, and we have done capacity building by way of training. Some of the points to improve, to ponder, like, so most of the diseases, if you see, the first outbreak is in border areas. So we need to have a better existing, improve the existing surveillance system and infrastructure. And we should have a better infrastructure for temporary sample storage. Some of the samples, actually, especially from the neighboring countries, I do not know, some flights, they don't accept it. So it is going to a third country, and then it is coming over here. Even within India also, sometimes flights, they don't accept. This has to be rectified. The country also needs a BSL-4 to conduct research on BSL-4 agents like Nipah, CCHF, and we need to have a better coordination with medical department and at the animal-human interface. Thank you.
Thank you, Dr. Venkatesh. We are now moving to a totally different location in the world. We're moving to Mali, and we're going to ask Dr. Burema Koriba, who's the head of laboratory operations for the Charles Mérieux laboratory there, to give us a 5-minute overview of his activities and importance. Go ahead, Dr. Koriba. Dr. Koriba, you're on mute.
Okay. Is it okay now?
Yes, good to see you, sir.
Yes. Thank you for inviting me to attend the meeting. I don't know how to share I'm trying to share my presentation, but unfortunately, I think it's
working.
Is it okay now?
Yes.
Yes, thanks. Okay, now I'm going to talk about pathogen surveillance and diagnostic in Mali. And as you know, I'm from the Centre d'Infectiologie Charles Mérieux in Bamako. And Mali is a country situated in West Africa and is facing a crisis since 10 years. And we are facing political crisis and security troubles. As you know, the jihadists occupied our northern part of the Mali. And the whole country has a limited diagnostic capacity. We have only 2 BSL-3 laboratories for the whole country. And the government organized regular response against outbreaks. And they have created an emergency operator center. And the surveillance of pathogens is based on One Health approach. We have 3 institutions coordinating this surveillance. The first is National Institute for Public Health, which is coordinating the response against outbreaks. We have Direction of Public Health, which is organizing the national surveillance. And the last is the Direction of Animal Health, which coordinates surveillance and response in livestock. And talking about diagnostic capacities, we have 5 laboratories organized in a network. The first one is the Laboratory of Bacteriology and Virology of the Institute of Public Health. The second one is my center, which is Centre d'Infectiologie Charles Mérieux, which has a BSL-3 lab and a mobile laboratory. The third one is the University Clinical Research Center, based at the Faculty of Medicine with 1 BSL-3. The fourth is Laboratory of Applied Molecular Biology, based at Faculty of Science. And the last one is the Central Veterinary Laboratory, coordinating the surveillance in the livestock. The national system is supported generally by the partners. When we have an outbreak, the laboratory organize the testing, and sometimes we use the mobile lab for testing samples suspecting for emerging pathogens. And this last slide show that the G5 Sahel region is facing, the security, and based on that, we have organized a biosecurity network of G5 Sahels and 5 centers in 5 different countries have, organized this network to be able to test pathogens when there is an outbreak. And this is only the network we have actually for emerging pathogens. This is the situation in our country. Thank you for your attention.
Bori Makariba, thank you very much for your overview. Would you please send me your slide deck? And also Dr. Venkatesh, can you send me yours as well? I would much appreciate that. Good to see you, sir. I'm moving forward quickly to Dr. Dinakar Raj, who is the Director for Center for Animal Health Studies at Tanuvas in India. And go ahead, Dr. Dinakar.
Yeah, thank you for the opportunity, and salutation to this illustrious participants. I just have a couple of points to share. Talking about pathogen genomics and so on, we have seen many cases of deaths due to outbreaks, and by the time we go to the place and try to diagnose, many times there are some palliative treatments given, and then the death stops, and we just don't know what kind of disease had affected, but everything comes back to normal. So I think the thrust should be given on diagnostics done in the field, something like probably a mobile BSL-3 lab kind of thing, where like to that outbreak site and There are technologies.
Your voice is not heard, Dinkar.
So what I suggest we do is we start with the next session, and maybe Dr. Dinakaraj can join us again.
Okay. Okay then, yes.
So Dr. Rao, go ahead, please.
So continuing diagnostics, we'll move to vaccine challenges. We are left with the last session. So I think Dr. Season Sainju is not around. We'll straight away go to Dr. Bairegowda, who himself is a R&D and production person in case of vaccines. He's a director of Indian Institute of Animal Health and Veterinary Biologicals, India. Dr. Bairegowda, please.
Thank you, sir. Greeting from IHNVB to all the delegates and participants. In fact, I should thank Dr. Kai and Dr. S.R.Rao for organizing such a very useful program in this pandemic situation. That too, recently we had a news that there is a H5N8 infection of humans in Russia. I think that this is a apt time. And I can also see that this is a spillover session of a very successful One Health program, what we had in Delhi in 2019. I wish we could have had a physical meeting of such a magnitude with all these eminent experts from all over the world, which our organizers have brought in one single platform. We all know that biosecurity and biosafety is mainly to reduce the risk of pathogens, and vaccination is the primary intervention in this direction. So when there is a successful vaccine and there is a successful vaccination, maybe talking more of biohazards and bio-risk will be minimized. Of course, we do have several challenges in vaccines and vaccine manufacture and all. We have heard a lot about the diseases, biosecurity and AMR and all those things. Maybe when it is concerned to the vaccines, when we see, like especially in Indian perspective and especially in some of the South Asian countries, we have a lot of challenge in facilities, lacking proper facilities, and we need to upgrade those facilities to meet the standards of international standards, and both in terms of GMP labs or BSL labs with respect to the production, as well as in the challenge sheds. Maybe most of us are aware that most of the production units, they lack the proper challenge sheds with the negative pressure and containment facilities to handle this proper challenge strains. Of course, funds will be a constraint for these things. And another challenge what we see in this with respect to the vaccines is availability of the uniform seed materials and challenge cultures. In fact, as a production man and as a research person, I faced a lot of difficulties in having a proper obtaining a proper seed cultures and also challenge cultures. There should be some uniformity, maybe I can say throughout the world, as a proper source for these materials, and with the complete data and characterized materials and with the records, so that we can trace the organisms from one location or one point to the another point. Another lacuna in our challenges, what we can see is uniform SOPs. That we all know that we require a uniform SOPs for operation of the facility and the handling and maintenance of the seed cultures, challenge strains, and these to be developed at all the manufacturing centers. Of course, a regular auditing of all these cultures is a must in a vaccine facility where we handle pathogenic organisms. And another challenge or requirement is knowledge source. We need badly this training of manpower in terms of biosecurity protocols and also the latest technology, both in vaccine production or handling of pathogenic organisms in production labs or in the challenge facilities. And another thing is what many people don't give much importance is monitoring of effluent from production facilities where such organisms are handled. Maybe a vaccine strain or a pathogenic strain, we need a proper biokill system or effluent system, and we should monitor the effluents very periodically for presence of any hazardous organisms in these facilities. And another challenge is what we face in terms of vaccination is building herd immunity. Of course, we see as in India, we can see lack of trained manpower, so that the manpower required to cover at least 80% of the or 90% of the population of livestock, it's not there. So most of the times vaccinations failure will be there. That is one challenge what we foresee in our country, and maybe it is true in most of our Asian countries also. And for some of the diseases, maybe availability of the vaccines is another constraint, like especially with respect to some zoonotic diseases like anthrax, brucella, and all those things. And another challenging aspect is animal identification and movement. So that is traceability. This is another challenge what we face, especially in most of the developing countries. So that unless we track or identify the vaccinated and unvaccinated population, it will not be a successful vaccination program. That challenges also we are facing. And one more thing is we need to prevent the spillover to the wild animals. That is an important aspect when we are thinking of controlling of these diseases. And when it comes to the anthrax, maybe we are taking up a special program with respect to the some of the like centers like Orissa, tackling of these diseases in wildlife and creating buffer zones to protect the wild animals by vaccination. This is not happening in most of the places. So this is another challenge. Unless we prevent the spillover, we cannot control the diseases very efficiently also in the domestic animals. And also need to address the zoonotic diseases. Of course, we have learned a lot about in today's session also. So of course, vaccination coverage of animals for zoonotic diseases is very important with respect to the diseases in animals as well as in humans, and giving more importance to like diseases like brucella, anthrax, rabies, leptospira, and tuberculosis, etc. And apart from these vaccine challenges, I need to stress upon that need to have more biosafety laboratories. Like our Venkatesh was telling, transporting of lab to a long distance is a challenging task right now, to especially for diagnosis or identifying the hazardous organisms. There is a need to have a localized district level biosafety labs, at least BSL2 labs, and creation of One Health centers. In fact, we thought of proposing to our government this year creation of a One Health centers where a person or in a single point, we can disease the diagnosis of both animals, humans, as well as to the plants. See, maybe that we can think of like whoever in the funding agencies in the international level can think of sponsoring such programs, so that samples can be handled at a very shortest possible time, so that interventions can be attended at a very in a drastic manner. This needs to be in terms of both in equipment as well as in capacity building. Here I would like to mention, like recently I came to know that our DRDO Defense Research Organization, they have come out with a mobile biosafety facility where they can take it with on wheels and take it to a lab. Like suppose there is an outbreak of avian influenza or Nipah or in one place, you can take this lab and test the samples there, give the results. Maybe more emphasis can be given on this. Of course, finally, this should be added, creating awareness, maybe in terms of vaccines, or maybe in terms of diseases, or maybe in terms of preventing measures, or maybe in terms of knowing, allowing people to know about these hazards of these diseases, creating awareness
is one of the important thing in this program.
Thank you very good.
So thank you, sir. Thank you very much, sir.
Thank you very much. And I think Dr. Dinakar's internet is back, I suppose. Dr. Dinakar Raj? Dr. Dinakar Raj? Hello? Hello, Dr. Dinakar Raj? Okay. I think he's still getting it connected.
Yeah, yes, sir, I can hear.
Yeah, please make your few remarks.
Can you hear me, sir?
Yes, yes,
Yeah,
yes.
I was just going to echo what Dr. Bailagowda and Venkatesh said. So it has to be a mobile BSL lab where people can kind of call when there's an outbreak, like an ambulance, and this lab goes and tries to diagnose it there, and using technologies like on-field technologies like Oxford Nanopore and so on, because this can really circumvent the need for total BSL-3 lab, the transport of samples, storage of samples, and so on. So this is something which, in a One Health scenario also could be helpful both for human and animal diseases. Yes, sir.
Yeah.
That's all.
Thank you, Dr. Dinakar Raj, and Tamil Nadu Veterinary University is a very strong partner with APAR. Thanks for that, Dr. Dinakar. We'll move back to vaccine challenges. I did trace Dr. P. Alexander, veterinary surgeon, Deputy Director, Sri Lanka Veterinary Institute. Dr. Alexander, are you on? I think so, he was there, yes. Dr. Alexander?
Yes. Thank you very much for giving this opportunity to present veterinary vaccine challenges in Sri Lanka.
Yeah, please go ahead.
Yeah.
We can see your screen.
Okay, let me share the screen. Yeah, right.
Thank you. Yeah. Please go ahead.
Yeah. I am presenting challenges in veterinary vaccines production in Sri Lanka. Yeah. Veterinary Research Institute is involved in vaccine production, veterinary vaccine production. Our vision is to be the center of excellence in research and development for the livestock industry. This is actually one part of our mission of the institute. Veterinary Research Institute is national laboratory and is administered by the Department of Animal Production and Health under Ministry of Agriculture. Present vaccine laboratory facilities. Vaccine Production Center was established in 1982. Animal Virology Laboratory re-established in 2007. Existing laboratories are refurbished time to time, improving biosafety facilities. We have basic biosafety and biosecurity facilities at present. These are the veterinary vaccines produced in Veterinary Research Institute. For cattle and goat, we produce 7 vaccines: hemorrhagic septicemia, blackwater vaccines, FMD, Brucella S19, tick fever, and bovine papillomatosis and contagious pustular dermatitis vaccines. For poultry diseases, 2 vaccines are produced: fowl cholera vaccine and Newcastle disease vaccines. Only swine pasteurellosis vaccines is produced for swine disease. Among these vaccines, 3 of them are live vaccines. Newcastle disease, Brucella S19 and tick fever vaccines are live, and other vaccines are killed vaccines. Here some of our facilities and products. The bioreactor is used to produce some inactivated vaccines, and freeze dryer is used to produce freeze-dried vaccines. The annual vaccine productions are shown here. The foot and mouth disease vaccine, 0.6 million doses. Newcastle disease vaccine, 7 million doses. Bovine papillomatosis and contagious CPD vaccines on request. Hemorrhagic septicemia vaccines, BQ vaccine and Brucella S19 vaccines are produced to our national program. Examples for development and improvements of our so far. Example for the HS declared as free, but a few sporadic cases recorded. Free status was achieved through locally produced vaccines. We have got funds to recently, and we could renovated vaccine production center. In addition, we could purchase the instrument equipment, including freeze dryer and FMD vaccines. Earlier, we produced 4 ml dose in aluminum hydroxide adjuvant, but now we produce 3 ml in oil adjuvant vaccines. New bioreactor with capacity of 200 liters will be purchased. These are our challenges and constraints. So the first one is high cost of production. Reagents and consumables are imported, and reagents cannot be purchased directly. And the most vaccines are issued to farmers free of charge. All production cost is borne by government. The second concern is lack of training for the vaccine production staff to upgrade the knowledge. No specialized personnel for the vaccine production. We have only hands-on experience. The third constraint third constraint is delay in getting raw materials. Need to follow financial regulations as via government institute. The procurement procedure is so long. Fourth identified constraint is interruption in the procedures. Equipment repairs take long time. Repeated repairs occur. The periodic quality testing breakdowns may occur, and they cannot acquire the expected results. Limited comparative studies on emerging field strains. Vaccine matching studies need to be expanded. Field efficacy, further investigations necessary on field efficacy. Difficulties have been encountered in sero and genetic typing of field strains. The other constraint is the conventional method in vaccine production. Now we are producing vaccine with the egg-based vaccines and the cell culture-based vaccines. Although laboratory equipped machines for production is still manual vaccine labeling and filling and labeling are doing. The logistic, inadequate production of some vaccines, the productions, there is a gap between productions and requirement. So part of the vaccines need to be imported. Mass vaccination program conducted by government sector, program not properly implemented due to more reasons: delay in incentives, inadequate staff, and vaccine supply delays, and etc. Limited research on vaccine improvement of self-sign and efficacy is
Dr. Alexander, time is up.
Yeah, the needed research area must be expanded to produce bivalent and multivalent vaccines. The last the constraint is difficulties in obtaining seed cultures to produce new vaccines. For some vaccines, seed derived from a seedlot system from very old imported seed, and for other vaccines, we produce in-house clinical isolate, example FMD, BQ, fowl cholera, swine pasteurellosis. Would be useful if we have seeds for fowl pox, IBD, and tick fever. Then we can expand our production area. Thank you.
Thanks, Mr. Alexander. Actually, between you and Bairegowda, quite a number of challenges have been identified. I think we'll definitely have a major session on these issues in the major conference that are going to come. I think with this, we'll go to the last session. The last session is very important in terms of our concept of APAR, particularly the economic burden of disease and outreach and interventions. I think we have two speakers. Professor Andre is there from Brazil and Professor Ramji Jirmare from Michigan State University. I think between them, we're going to hear the very important topic about economic burden of disease, etc. I think I request Dr. Andre D. Melo, representative, NEST Brazil Secretariat, the Institute of Applied Economic Research, APAR. Dr. Andre, please go ahead.
Thank you, Chair. And many thanks for the invitation to participate in this event. I work for the Institute of Applied Economic Research, as was already said. This is a governmental think tank in Brazil. And let me address the economic and political issues surrounding the pandemic and vaccines, which is in accordance to my own research background. Now, as you know, COVID-19 is not just a sanitary crisis, but it's also an economic one. And it is so for several reasons. Most immediately after the outbreak of the pandemic, what we saw was that social distancing had in general paralyzed economic activity. And it has done so in certain sectors more than in others. But the sectors that were most hardly hit clearly were the ones of services. So in particular, entertainment and culture were very hardly hit. For obvious reasons, tourism and travel were also highly impacted, and also education, among others. Now, a few sectors have also benefited from the pandemic. And here, I think the most noteworthy case is the one of digital technologies, and also for very clear reasons. Because there was social distancing, there was also a greater need to use these technologies, which have favored these sectors. So the economic impact of COVID-19 is clearly unequal across sectors. But in general, we can say that it has been very negative, and that most sectors have, by and large, suffered from the pandemic because the economy as a whole has been stalled. Now, another impact of the pandemic, which is not as visible and not as widely recognized as the one from social distancing that's most straightforward, that is just to prevent people from leaving their homes, has to do with the disorganization of supply chains and even the breaking or interruption of production chains. Because of the pandemic, uncertainty has been very high. And in context of high uncertainty, planning becomes less effective and becomes a lot more difficult, which means that if certain actors operating at certain stages of the pandemic do not plan well, there might be, for instance, a lack of raw materials or intermediate goods, which will be felt down the chain and will prevent the production and the commercialization of certain final products, and some of which are actually quite important, are essential products. And we might think of food, or we might even think of medicines or others. And so this has been highly felt in my own country, in Brazil. There was a disorganization of the supply chain. And this illustrates how the pandemic not only hits on the demand side, by imposing social distancing measures, by preventing consumers from leaving physically their homes, but it also has a very significant impact on the supply side as well. And this prevents the recovery of the industrial sectors in the economy in most countries, by the way, even though my country might be a particular case in point here. Now, it's also important to note the economic recession that has been caused by COVID-19, it has stricken major economies in different phases. So the initial expectation that many economists had that there would be a so-called V-shaped recovery, the world as a whole would dive into recession and recover very quickly as the sanitary conditions were addressed. This is becoming increasingly unlikely. We are a lot more likely to see an L-shaped or perhaps a U-shaped recovery. In some countries are recovering more quickly than others, this is clear, but the virus, from what we can tell, is likely to stay with us for a long time, despite vaccination. And so the economic effects are also accordingly likely to stay here for the foreseeable future. As was already mentioned previously in a presentation in this event, the estimation of an economic loss surpasses 28 trillion US dollars. And even though there's high uncertainty about this estimation as well, for obvious reasons, it is very hard to estimate the total losses, and their indirect effects are many and are not always visible. So it is clear that overcoming the economic crisis will necessarily involve overcoming the health crisis. And it's necessary to stress this because several populist leaders, including the one in my country, have argued that it was important to prioritize economic recovery over the health recovery. And stating, for instance, that rising unemployment and decline in income would have even more adverse effects than the spread of the coronavirus. And this is clearly a fallacious line of reasoning. It's clear by now that if and to the extent that the sanitary crisis, is not addressed, then there will be no economic recovery as well. But there's a lot of data that shows that those countries that are recovering the quickest and that are recovering the most are precisely the countries that are more successful in addressing the pandemic. And it is also clear that even if we can lift social distancing measures, as has been done, including in Brazil, but in other countries as well, in the United States, in the midst of a very serious spike in coronavirus contamination, consumers, they will not feel confident in any case. So even if there are no legal or administrative decisions to force people into lockdown, to force them to stay at home, they will voluntarily not go out, and they will not also spend money given the uncertainties that the pandemic brings. So confidence here is key, and consumers will only feel confident to leave their houses and to spend once the pandemic is under control. The experience of China here, I think it's very noteworthy because China, as you know, was the first epicenter of the pandemic. It's where it supposedly originated, and it was the first country to be hardly hit by the coronavirus, but it was also the first major economy to recover from it. And it's actually one of the few major economies that last year experienced economic growth. So again, to stress, yes.
Time is going up.
Okay, I'll conclude. And sorry for going over time. So my final point is regarding how to address the sanitary crisis, which will allow us also to economically recover. There's only one way, from what specialists tells us, and this is widespread vaccination, right? The initial hope that we could reach a herd immunity just by having large numbers of people being contaminated is unjustified. And again, Brazil illustrates this nicely. Manaus is a city where specialists estimate more than 76% of the populations have been infected, and still it's having a very harsh second wave of the virus spread. But vaccination has also proceeded in very unequal terms throughout the globe. Canada has purchased more than 10 doses per person of vaccine, the UK 5.5 doses per person, and in contrast, Brazil has only 1.2, Latin America as a whole has 0.4, and the African Union has only 0.2. So this is a public good. Health is perhaps the quintessential public good. And if we need to address the health crisis, we can only do it as a whole. We cannot do it as countries in a separate fashion. And so there is a need to address the shortages of vaccines in the developing world if we're going to be successful in overcoming the COVID-19. And for that purpose, there's also a need for greater international cooperation. It is clear that the Western countries, by and large, have only been preoccupied with vaccinating their own populations, whereas most of the global supply of vaccines have been coming from Asian countries, and particularly China and India. Now, if there is no greater international cooperation, the COVAX initiative notwithstanding, we are likely to see, again, that some countries will proceed with vaccination where others will be left behind. And this is not a recipe for overcoming the pandemic globally. And I'll stop here. Thank you.
Thank you. Thanks. I think the COVID experience has a lot to be learned for other pandemics. I think we'll shift to Dr. Ramji. Ramji from Zoonotic Diseases International Training Program, Department of Community Sustainability, Michigan State University. And I think I should congratulate you being the last speaker of the whole session. So please go ahead. Yeah.
Can you hear me?
Yes, we can hear you.
Thank you, Dr. Rao. Thank you, APAR organizer, for inviting me to this workshop. It is a wonderful opportunity, to be here with you and sharing my experiences. First of all, I like to let you know that I'm not an economic person, unlike what you introduced me earlier. So to make the background clearer. Most of the speakers, earlier speakers have already mentioned the background of the zoonotic diseases, especially the COVID-19, how it is affecting all of us, the entire world, and all these systems, social, business, and environmental system. So I don't want to go much on that, but since there are so many actors and relationships involved in these zoonotic diseases, it is extremely challenging to assess the economic burden of zoonotic diseases. This said, we have been noticing the devastation of COVID-19, as previous speakers mentioned. It has cost the world over $28 trillion, and this cost will definitely go up since we don't see anywhere that this COVID-19 will be controlled anytime soon. And it is also important to note that 70% of the world's rural poor depend on livestock and working animals for their livelihoods. And these zoonotic diseases have the longest and severe and very hard impact on these people. And whatever the evaluation or assessment of the burden we do, we have to take this group into account. And so these diseases, zoonotic diseases, are impacting our socioeconomic system, production system, and environmental system. Vis-a-vis, zoonotic disease, these systems are also being affected by these zoonotic diseases. And also, it is important to note that, as the previous speakers mentioned, industrialized countries are relatively at upper hand or better off while dealing with zoonotic diseases, and because they have more resources, financial, human, and other resources, unlike developing countries where there is a lack of interagency coordination, lack of surveillance mechanism, as well as diagnostic capacity and infrastructure are also not well aligned. This said, a couple of these studies done about several genetic diseases have highlighted that there is a huge cost that the country or world is paying off because of these zoonotic diseases. And especially one important point I would like to stress is that the study have found that especially there are some diseases which go unsymptomatic and subclinical. They often become unnoticed or not accounted for when evaluating or assessing the genetic burden of the genetic diseases, and we should be very mindful of that. And without going in detail about the variable to be considered in evaluating the burden of zoonosis, I would like to share a couple of points here. We're evaluating the burden, all events that are in there at pre, during, and post zoonotic diseases have to be taken into account. Also, activities and events that fall under both vertical and horizontal pathways of those diseases also have to be taken into account. And we have to be mindful that, or we have to inform our stakeholders that zoonotic diseases do not only have immediate and short-term effect, there are long-term effect, because there are many multi-layer and long-term effect, and we have to be mindful of these factors as well. And assessing the burden of any zoonotic diseases, requires a multidisciplinary team comprising economics, veterinarian, public health officials, environmentalists, and socioeconomics, and these evaluators should have good understanding, in-depth understanding of the ecology of the disease, and detailed knowledge of the transmission pathways is another important criteria. And cost for outreach and intervention are often not taken into account when assessing the burden. So especially in the developing countries where already surveillance, control, containment, and as well as outreach and intervention are often overlooked or not given due importance, and these factors also have to be taken into account. And I would like to stress that there are some social and psychological consequences or effect, and all on the people who are affected by zoonotic diseases, and we cannot count or you cannot assess those effects in monetary term. So I didn't see any method to calculate those effects. So we all should have. We have to make our effort to calculate them, to find a way to calculate them. And we have to make aware our stakeholders and general public of aware of the pathways, biology, and effect of diseases under evaluation. And global, as previous speakers mentioned, global alliance or cooperation interagency is very important. And whatever intervention or outreach we follow or we adopt, they should be cost effective, environmentally friendly, and socially just, so that local stakeholders or local people whom we are intending our those practices and intervention, they will appreciate and adapt those practices. And finally, adoption of I take this opportunity to inform you all that MSU is being part of the MSU. We are very glad to be part of this team, APAR team, and this workshop. We are hosting an international short course on zoonotic diseases from March 22 to 26, and we have reached out to many of the participants I see here to serve as the speakers, and you have accepted our invitations. Thank you all for your support, and we look forward to more collaboration in years to come and contribute to Global One Health initiative on managing zoonotic diseases in the future. Thank you so much. Thank you for the time and opportunity.
Thanks, Professor Ramji. That was very great talk to end with the whole sessions. We got a lot of insight into the issues, and I will just go over to Dr. Kai for concluding remarks. Dr. Kai?
Yes. So thank you all. We've come to the end of the workshop. First of all, I think we all deserve a big round of applause. Thank you, thank you, thank you for providing such great thought leadership and thoughts and showcasing your commitment to advancing this important field. Thus, a lot of things have been covered today, and I won't even attempt to summarize all the salient and important things that we did today. So what we will be doing over the course of the next month is to actually summarize all of these comments into a document that we will be sharing with you for review and additional insights. The comments that were made in the checkbox will also be integrated. So what I actually found very interesting is that already in the background, a lot of people are communicating with each other, looking at ideas on how they may collaborate. I was copied on some of those, which is very exciting. Because what we really want to make sure is that this is not just another workshop, this is not just going to be another global symposia, but that we can drive actionable outcomes, expanding the network, but also building joint programs and projects and pursue of global sponsor and donor funding. So we invite you to be part of this initiative. Please reach out to us. We would also like you to participate in the organizing committee for the symposium. Let us know, please. You know, we have our emails. You can reach us through our website as well. Again, thank you for your contributions and for just a fantastic 3.5 hours of today. Really exciting. So some closing remarks to you, Dr. Rao, please.
Yeah, thank you very much. I think you said it, that what is the action next to us. I think we are very, very grateful to all of you for holding on for 3.5 hours. It's a long time and we didn't realize it went on so smoothly. So many inputs. I think my role is just to finally say, thanks to some key people, all of them have contributed, thanks to all of them, but to some who have made us to have such a huge collection of experts globally. One is Dr. Rahman from ILRI, South Asia, who has been connecting us to the entire South Asia. Thanks, Dr. Rahman, for being a partner of our APAR for the service that you have done. And then Dr. Karim Maradia, I do see him here or not. Dr. Karim is from Michigan State University. He has been greatly helpful in not only mobilizing good experts from MSU and also becoming partner to Alliance for Pandemic Partnership. And then the one from Europe, Dr. Bruce Whitelaw, still I find him, so he's still there. And thanks, Dr. Bruce. I think you are a great friend of us. You have made his life very successful with 2-3 experts and also yourself giving such a great insight into how to go about One Health entrepreneurship. The last is Dr. Diana from USDA. She also gave us a lot of insight into our conversations and also asked Dr. Joseph to contribute what are the programs of USDA. I thank Dr. Tripathy and Dr. I think a lot of other people, dignitaries here, for making us Dr. Swaminathan, for accepting Dr. Diener from ILRI to give opening remarks, and all one and all, I thank you all. We'll get back to you soon with all the summary, and then we'll take your suggestions for the major conference that we are planning. Thank you very much. From India, good night. Thank you very much.